joining us. And I think because of the time change, it seems we are starting an hour earlier, and many of our panelists and attendees might be a little bit late, but it's okay because we have enough time. And oh my gosh, whenever we feel it's not going to get worse, it keeps getting worse because our world is controlled by genociders, by genocidal nations, genocidal leaders, genocidal societies. And here in the US, who were hoping that our country will hold the genocide perpetrators accountable, are themselves being committed and being implicated and actively committing genocide now. And we know from history that any genocider, if they are not held accountable, they continue to expand, commit their crimes. Countries built on sin and genocide, including the United States, Canada, Israel, will always continue to live by the sword, by genocide. These are the new axis of evil. The Israeli regime, the American regime, the Canadian regime are not democracies. If this what democracy means, we don't want democracy anymore in this world. Whatever they call, but this democracy, is, however they implement it, is a danger to humanity. They are putting all our world at risk and risking a global and possibly a nuclear war. The only thing that stopped genocide there, Trump and psychopath Trump, the first administration, from committing these crimes was the COVID pandemic. Unfortunately, there is no pandemic now, and I think the world is in danger since he still has 3 more years to ensure havoc on the whole world. We meet at a moment of extraordinary danger. What began as the destruction of Gaza and the attempted erasure of the Palestinian life is now expanding into a wider regional catastrophe. Over the past weeks, we have seen the war spread beyond Gaza and Palestine into Lebanon and now Iran. The United States, the genocider in chief, after years of political and military backing, is now fully participating in this war alongside Israel, a war that is rapidly escalating and placing millions and tens of millions of civilians at risk across the region. The consequences are already devastating. The hospitals are being struck, schools are being struck, entire civilian neighborhoods are being reduced to rubble. The World Health Organization reports that at least 13 hospitals and health facilities have been hit in Iran since the start of this illegal US-Israeli attack, with medics killed and many more injured. One of the most horrific events of this war was the bombing of the school in Minab, the Shajara Tayyiba. Shajara Tayyiba in Arabic means the blessed tree. Imagine an elementary school of babies called the blessed tree of life being bombed to rubble, killing more than 160 babies and elementary school children with one missile, where the missiles destroyed the girls' school during the school day. And it was a double attack. The first attack killed maybe half the pupils, and when the teachers and the staff tried to move them to another space, safer space, the prayer room in the school, they hit them again, killing the rest. Most of these children are between the age of 7 and 12. For every one of you out there, every human being in the world, imagine your child, 7-year-old, 8-year-old, that you sent them to school in the morning and never have them back because the world is ruled by a criminal country and a criminal regime called the United States of America. For those of us in medicine, the meaning of this is unmistakable. When hospitals are bombed, when ambulances are targeted, when children in classrooms become casualties of missiles, we are not witnessing the defense of civilization. We are witnessing the collapse of rules meant to protect humanity itself. The expansion of this war threatens to destabilize the entire region and to normalize the targeting of civilians, medical infrastructure, and essential services. And that's why accountability matters. The international community cannot remain silent while civilian populations are subjected to bombardment, displacement, and the destruction of the very institutions that sustain life. Governments, institutions, and civil society must demand an immediate end to these atrocities and insist that the international humanitarian law be upheld. But our responsibility as physicians and healthcare workers does not stop with speaking out. While we fight for justice and accountability, we must also stand with the victims and the survivors. We must support our colleagues who continue to practice medicine under bombardment. And we must rebuild what those wars attempt to erase. That is why today we are also discussing our campaign to rebuild critical departments at Kamal Udwan Hospital in northern Gaza, the pediatric and obstetric emergency rooms, the laboratory, and the radiology, so that children, mothers, and families have somewhere to turn to care. These are the communities that Dr. Hussam Abu Safiya sacrificed his freedom and insisted on not betraying them or abandoning them before he got abducted, and he continues to endure harsh treatment and torture at the hands of the genocidal regime in Israel. In honor of his memory, we are rebuilding the very same hospital that was providing for his children and for his community, despite the will of the genociders. And we call upon everyone to amplify the campaign to release him and all the 10,000 Palestinian hostages being taken illegally by the criminal and genocidal regime of Israel and its puppet, the criminal and genocidal regime of the United States of America. Because medicine does not abandon people, and neither will we. Thank you all for being here, for standing with the global movement to defend life. We have a long list of speakers today. It's going to be a very important program. It is heavy. These are heavy days. We cannot breathe. We cannot sleep. We're all struggling, but we will not give up because the stakes are high and humanity is at the stake. Some of the panelists are a little bit late because of the time change here in the United States. We are an hour early, but they will join us soon. So we're going to start with our colleagues here. I'm going to start with Jamie Sharp, a fourth-year medical student from Minnesota, who's going to give us some updates about their work in their hospital against the fascist attack of ICE against our communities, against our hospitals, against our patients in Minnesota and all over the United States. So thank you, Jamie, for joining us. I'll give you the opportunity to speak, and we are really grateful for your work, for your organizing, and for keeping us updated and informing us on ways that all of us should be aware of to continue and to amplify this fight to defend life and humanity and basic human decency. Thank you, Jamie. Go ahead.
Thank you, everyone, for having me again. I'm just going to put in a chat to the hosts and panelists, and maybe someone could put this into like the general participant chat, a GoFundMe about the case I'm going to be talking about today. Thanks for having me back. I think last time I was here was the day after Alex Preddy got shot, the ICU nurse here in Minneapolis, during Operation Metro Surge. So much has happened since then. I think front of this group, especially right now, with the escalation of our genocidal tactics and imperialist violence internationally. But I think Minneapolis has been an interesting place to kind of see that and those tactics in this like microcosm of like a domestic space. So that's what I'm going to be talking about today. But I just wanted to just ground that I'm, I'll be talking about our small neighborhood here, but that I am thinking, thinking and hoping that this lands in a way that grounds what the true horror and mass killing that's happening internationally right now. So Operation Metro Surge, supposedly like came to a close here in Minneapolis. I think a lot of people are spreading this idea that the people on the ground scared ICE out of our town. I think between on the ground grassroots organizing and largely just intense response on the streets that ICE left. I think that to give ourselves some credit, I do think that happened. But I think the bigger story at play is that actually ICE and Trump got exactly what they came for in Minneapolis, and that was to take away our sanctuary city status. They came with the understanding that Minneapolis and our public institutions and entities were claiming not to cooperate with fascism, not to cooperate with federal government operations, and through what they did on the ground in negotiations with politicians who do not have a backbone, who do not represent the community, they were successful. And this case that I'm going to share with you speaks to that. I'm going to be talking about Adrian Sotello Guzman. He's a 27-year-old man who last Thursday we were notified of a young man who, with a long history of bipolar disorder, who was at Fairview Southdale Hospital, a suburban hospital here in the Twin City Metro, an individual who was under ICE custody. We later found out he was riding one of our light rail trains, public transportation, and was having some sort of a mental health crisis. So the police picked him up, as they do in a place where police and jail is kind of our treatment for people with mental health problems. And they took him to jail. And unfortunately, this individual was released directly to ICE from our county sheriff. When this person got into ICE custody, he was notably psychotic, having intense psychiatric symptoms, delusions, talking to himself, visual, auditory hallucinations. And so he was actually taken to the hospital by ICE. And this is a practice that at this point in Minneapolis, we're very encouraging of. We know that there's no medical care in ICE detention. So he was taken to the hospital and he was put in the emergency room, and he stayed in the emergency room for 7 days waiting for a psych inpatient bed. This is when we were called, and we were called by frontline workers because they heard that the hospital, despite this patient not being stable, not having medical decision-making capacity, still being floridly psychotic, the hospital had chosen to discharge this patient to ICE so that way he could be shipped to Texas. So we found out about this, and I went to the hospital when we found out, and we attempted to stop the discharge. I got to the hospital and told management that this is an unsafe discharge plan. It's against federal law to release somebody without medical capacity to law enforcement. It's against the law to discharge someone who's not medically stable from an emergency department. That breaks EMTALA. And told him that we know what's going on. There was a habeas filing that was still pending. The patient also was scheduled for a civil commitment case here in Minnesota the following day. So our statement to the administration was, you guys need to wait. You need to hold this discharge, essentially until we can ensure that our state entities are met and respected. So I go to the hospital, and this nurse manager tells me to wait in the lobby, and that he's going to take care of everything. In the meantime, the frontline staff are running around, and behind their manager's back, they're telling me, you cannot trust this person. They're lying to you, and they're sneaking this patient out the back door. So I was able to go outside and see that they were actively discharging this patient without medical capacity in handcuffs and no shoes into the ICE vehicle. We have concerns that chemical restraints were used, and this individual was shipped to Texas. And since then, we haven't been able to figure out where he is. This is someone who doesn't know who he is, where he is, does not know his name, unable to use a telephone, and now all of a sudden he's just been removed. We're working really hard to get him back. I put the GoFundMe in the chat. If anyone can distribute through their own networks, we're trying to raise money both for legal funds, but also so that way we can find a way to get him back to Minnesota if he does get released. But I wanted to talk about this case here today, mainly because I think that the murdering of, the disappearance of, the removal of individuals who are mentally ill or who are homeless, that is an essential tenet of genocide and fascism. This idea of removing people from the streets, this idea of removing unwanted people who are usually in the shadows of our society. And I don't want to claim that we have great solutions for these issues here in the US. However, I think as we've seen throughout history, the systematic removal of these people is like a central aspect of large scale fascism and genocide. I think people will remember that in the summer of 2025, Trump passed the executive order criminalizing mental illness, criminalizing substance use disorder, criminalizing houselessness, and supporting what he described as the institutionalization of these populations, and kind of alluding that detention centers would serve as such. However, I think what we need to keep in mind, and this is not just from understanding the deinstitutionalization, neoliberal movements in the 1970s, 80s, and 90s, but I think looking further back and seeing what regimes like Nazi Germany did to mentally ill people, people who were on the streets, that understanding that this is part of the algorithm, part of the vocabulary of mass removal, mass family separation, and steps towards further empowering a fascist government that has that intention to do it to anybody that stands in their way of any of their money-making, war-mongering intentions. I think that this individual, he wasn't homeless. He has a family that is active in his life. I don't want to suggest that he really embodies all of these identities. However, this is a sentinel case. This is the first of our knowledge in the country case in which an individual of this nature is being systematically removed. And I want to emphasize, not just by the Trump administration. This was Minnesota local government. This was the Metro Transit and the county sheriff and the county jails. And then most importantly, and this is why this is important for this webinar, our corporate hospital administration. For these hospitals, for our counties, it's economic to remove these people. It is actually profitable to get rid of these people. And that is also part of the equation that this Trump government is running off of to receive the support, not just of the racists, not just of the people who are making money off of blowing people up, but off of the people who are making money off of anybody suffering in this country, and that's corporate healthcare executives. So I think that I don't want to utilize this case in a way that is unethical. We had the family support to share this case, and they want people to know what's happening and what has happened to them, and we're going to hold the people at this hospital accountable. I think there's an enormous malpractice case from a lot of the details that we're picking up, but I want people around the country and the world to know that this is happening here, that what happened to Adrian is not only unjust because he's alone and he's vulnerable in Texas, but because of what it represents for all of us who are facing this fascist regime, whether it's overseas as bombs are falling from the sky, or whether it's here with vulnerable people intentionally, systematically, economically being sold and removed for the benefit of the kind of the moderate, blue progressive city that's been kind of put on billboards nationwide as the heroes that kicked out ICE, but understanding that now we're just starting to learn how to live with ICE around us at all times. It's a pessimistic, kind of upsetting story, but I think it's important for you all to know about as this starts to proceed nationwide. And if anyone has money to give to the GoFundMe, or if people have networks that they can pass that around, we can personally assure you all of this will go back to getting Adrian back to his family and safe. But thank you so much for having me, and I look forward to hearing for the rest of the seminar here.
Thank you. Thank you, Jamie. Go ahead, Karama.
Thank you, Jamie. I did not catch the beginning of what you said, but I'm wondering what is the hospital that is involved in this? What's the hospital doing? Did they issue a statement? Did they make an attempt for policy institution to protect people like this man? And like you said, I mean, the solution is not taking vulnerable people to ICE detention center or detention center in general. The solution is to actually find a solution for them with case management, with social workers, and all the resources that we all have at our disposal in hospitals. So this is very disturbing.
This is very disturbing. So unfortunately, the day of, I was physically removed from the hospital. I was physically escorted off of hospital property after I videotaped what happened and tried to stop it. And notably, it's called Fairview. It's a large corporate entity here in Minnesota. It's actually the third biggest employer in the state, only behind the state of Minnesota and Mayo Clinic. So it's a massive corporation. They have hospitals all over. And we actually had a press conference on their lawn the week before this incident, asking them to improve their policies for working with ICE. And if they would have implemented these policies, none of this could have happened to this individual. They would have been protected. However, unfortunately, after this incident, Fairview didn't reach out to us. They didn't reach out to the family. It's notable that they actually denied family visitation during this patient's week-long hospital stay. They denied family updates. This family actually cooked warm cultural foods, which, as we know, for someone experiencing a psychiatric emergency, being met with familiar cultural things is one of the most healing things they can do. This family brought warm cultural foods to the hospital, and they were turned away. We actually held a meeting with the administrators and the family. We brought the family to this meeting. We brought the mom, and the administrators still defended the hospital during this meeting. And I asked them, I said, you need to send this family some resources. And they sent me a 1-800 number. I think what's interesting, and I think this is important, is they, instead of sending us someone who had power to change policy or had power to really help this family, they sent us a DEI type person, someone who had been hired as an equity officer, diversity, equity, inclusion, kind of following the George Floyd murders. We had this explosion of corporate, and we're seeing that play out with Target, right now, but these kind of corporate entities that were trying to kind of do performative justice. And they sent this person to us who is Latino. And it really just led to some really challenging conversations that I felt like put us, the family, and this equity worker in really hard position, because no one can do anything to actually help this family. So long story short, this hospital entity has done absolutely nothing to address it, and they're currently trying to push it under the rug. And that's why we're here trying to raise awareness. And, after we get him back, right now we're just focusing on getting him back. And after we get him back, I think the plan will be to hold this institution accountable. But I think, for me, it's gonna, I kind of expected it to be easier. I think it's going to be a really hard process holding such a large corporate entity accountable, especially because the truth is that a lot of people, particularly in our culture here in the US, do not see someone's life like Adrian's as valuable. People are so accepting that an entity might just try to get rid of them. So it's challenging, and I'm not super optimistic that this institution is going to be able to provide any accountability outside of a malpractice suit.
Let us know how we can help. I mean, this is our communities and our hospitals and our patients. So this is very much linked to what we do as medical professionals in the United States, as Doctors Against Genocide, and as anyone who's listening to us. So we'll put the link for this man so we can help. But this is very, very important, and it is sliding into fascism and genocide, no question about it. When it's okay to basically single out a group or a person and make their life inconsequential. So it's
Jamie, I have to apologize too. I was busy trying to get the other panelists who are late. I missed the first couple of minutes. What's the problem with them? What is their take on this individual exactly? I'm sorry.
The hospital unsafely discharged someone who is actively psychotic and without medical capacity into ICE and just shipped him to Texas. And the doctors,
Because why to ICE?
we don't
He's
know.
undocumented.
The
He's
doctors
undocumented.
and nurses the doctors and nurses tried to stop the discharge, but the administration pushed it through. I think it's a mix of them wanting to appeal to the administration and not wanting to get in trouble. More of that anticipatory obedience. But on the flip side, I also think that this is an expensive patient and a chronic ER boarder who's taken up space in the hospital. And if they can get rid of them, I think they're happy to. So I think it's another example of just it's both from their perspective morally and economically favorable for them to essentially treat this person as this human life as dispensable. And I think that speaks to both the corporate and fascist elements of the case.
So yeah, it's corporate medicine, medicine for profit, and racism all combined. The usual way how our medicine, unfortunately, traditionally has been part of these systems for decades. Thank you, Jamie.
Yeah, thank you. And I'll send you the link to post, but then I'll also send you, we put together a little reel and we'll collab with you on Instagram when we post it. Thank you so much.
Please, we're happy to support. Please reach out to us too.
Thank
Yeah.
you.
Yeah. And now, again, many of our panelists are late because of the time saving that we did not
Oh,
warn
that's
them off,
true.
but it's
Yeah.
okay. That's fine. We will have the
Sunday.
opportunity to speak with or to hear from one of the most honorable human beings on this planet. His mere existence itself, his ethics, his moral compass is inspiring and is a light to all of us. I wish that all people in the world are like him because we will have a better humanity and we will never have to fight each other any longer. That is Dr. Yiping G. Dr. Yiping, please. I mean, every time I hear for you or read for you, man, I mean, you are just an example of the perfect human being that that. I mean, honestly, this
We
world
love
does
you,
not deserve
Yiping.
you. This world does not deserve you, but this is the world that we would really love and with people like you.
Thank you,
And well,
Dr.
we know we're gonna keep you busy this coming week, but we still want more of you. So go ahead.
Yes, it's going to be a busy week because I'm looking forward to joining the team as we go to, Capitol Hill this Wednesday, but also for the fundraiser event in New York the day after on Thursday. But we've also got a fundraiser event in DC on the Tuesday evening. So I'm looking forward to our busy week ahead together. But I want to challenge you, Dr. Nadal, that I'm not a perfect person. No one is.
No
So,
one is perfect. Now we don't need
um,
perfection anyway. But you can just read whatever you posted on your LinkedIn yesterday or the day before, regardless of the politician or the whatever political thing is. We want your take on how we can envision a better humanity.
yeah, I will.
That better humanity and better world are possible.
Yeah, why don't I do that? Because I think the things that I shared at this political event in Ottawa a few days ago, I hope resonates with all of you. And yeah, because it's about love and it's about how our movement is fueled by love, and the work that lies ahead is the responsibility of all of ours. Um, so over the past few years, I have seen the worst of humanity and its best. I've seen how institutions and people in authority positions put the interests of the rich and powerful, systems and structures of colonialism and capitalism, and economies of death, destruction, and genocide over the interests of the people and communities they're supposed to serve and care for. I've witnessed Canadian politicians who sit in the House of Commons, it's where, a few blocks from where I'm even calling in from, in Ottawa, uh, they defend the war and military economy, not refuting that Canadian-made parts and technologies are being used in war crimes, crimes against humanity, and active genocides around the world, but actively supporting this economy of war and militarism because it is profitable and it gives people jobs here in Canada. The things that I've seen and heard are appalling and disgusting, and I think anyone with a heart would be truly against fueling an economy of militarism and genocide if they actually understood the human and environmental costs of war. I dreamt of my grandmother last night. She was one of my best friends. She passed away during medical school training for me. I remember explaining to her I wanted to study and practice medicine and public health because there's something special about caring for people and communities and working to address the broader and more structural conditions that lead to poor health outcomes. Because in a world that is fueled by capitalism and colonialism, taking care of people and communities is a radical act of defiance against a system that wants to see us all fall in line and remain silent in the face of injustice. I wish she could see how far I have come, but I know that her love has been in part what has kept me going all these years, because we are fueled by love. My medical training and practice has taken me places that have taught me hard truths that no politician or authority figure could ever convince me otherwise. I've worked with Indigenous communities here on Turtle Island who have shown me that their sovereignty and self-determination as peoples are not determined by any particular political party or government. And it was through working with them, researching with, and caring for Indigenous patients and communities that I learned the devastating impacts of settler colonialism on Indigenous peoples and their lands, including the land upon which I'm calling in from, unceded, unsurrendered Algonquin and Anishinaabe land. I've trained and worked in community health centers and homeless shelters in the city, in Ottawa, in rural and remote communities in Nunavut, in Canada's north, and with Indigenous communities in Palestine, subjected to colonial violence and genocide being perpetrated by Israel and funded and armed by many states, including Canada. What these experiences taught me was how deeply unjust and unfair this world and society is that we live in. There will be politicians and political parties and governments that will come and go and tell us that some lives are not worth as much as others, or not worth anything at all. These bad faith actors will tell us that for some people in this world to thrive, other people need to suffer. I've seen how so many communities have come under attack because of the politics of hate, dehumanization, and division. People with disabilities or who are differently abled, people who use drugs, people who are experiencing homelessness, people who are trans and queer, people who are immigrants and refugees, people who are indigenous or Black or racialized. Do not let this world tell you a different one isn't possible. Do not let this world tell you that some lives are worth less than others. Do not let this world push you towards apathy and inaction. Your rage, your anger, your sorrow, your grief is justified. So stay soft and tender, with hearts open to hold the suffering of our fellow human kin. We have enough love to hold it all. What you might experience upon bearing witness to the vast injustices and inequities this world has is moral injury. It means you are human. Speak truth to power, even if your voice trembles and your knees shake. Believe me, I have been there. Speak up and organize, despite fear and repression. Our courage to push through is what makes us human. Our commitment to human rights for all is what makes us human. So this movement that many people have been building is part of a broader social political movement, and that includes the movement that Doctors Against Genocide has been building, and is ultimately fighting back against against fascism, as we've heard from Jamie Sharp, and is defending and fighting for human rights for all. We are fueled by love for a different world that we will organize and fight for together. This work is lifelong. This work is intergenerational. So thank you all for being a part of it and building together towards human rights for all.
Wow, speechless. Do not let this world tell you that a better one is not possible. Yes, we all need to keep this promise and keep fighting for this. Luckily now we are joined by Dr. Evelyn Hitti. She's currently working in the emergency room in Beirut and she's very busy. So I'm going to go directly to her before she gets busy again. So Evelyn, Maisa, can you tell Evelyn how to fix the screen or remove the screen, please?
Oh,
I'm going to
Evelyn.
introduce her while she's doing this.
Okay. First of all,
So
good to see you,
Dr.
Evelyn.
Yeah,
Uh,
Dr. Evelyn Hitti is the chair and professor of clinical emergency medicine at the American University of Beirut, Lebanon. She has led the Department of Emergency Medicine at AUB since 2012, taking it from its infancy phase to a full-fledged academic department with 6 EM training programs and the busiest emergency department clinical operation in Lebanon. Throughout her tenure, Dr. Hatti has led the emergency department through multiple crises, including COVID, financial collapse, Beirut port, Beirut port blast, the pager attack, as well as over 16 mass casualty incidents. She graduated with an MD and MBA degree from Johns Hopkins University, along with our colleague, Dr. Adla Sukkar. They were classmates and they were causing trouble together, fighting fascism even at that time, where she completed her residency training in emergency medicine. Her scholarly work focuses on evidence-based health management in low-resource contexts and mass casualty responses. Thank you, Dr. Evelyn, for making the time to join us. I know it's very hard for you. I know things are tough in Lebanon. So I'm not gonna waste any more time. It's all yours. And please, if you can, just remove the background. Go to video. Is it, how do you do that?
yeah, I'm just gonna tell her try to do it through text, but it's hard.
Do you hear us, Evelyn?
On your screen, Evelyn, like there's
Yeah.
a video. Do you see where it says video at the bottom left corner?
The picture of a video?
Yeah, the video. Yeah.
Yeah, and there's a
Okay.
little arrow next to it. Just click that.
Yeah.
And
Adjust background.
Yes.
yes, adjust background and effects, and then do none. Pick none.
Video. None. Okay. Thank you.
Oh,
good to see
So
you.
perfect.
thank you
We
for the
see
lovely
you.
intro. And with all of that, I still don't know how to manage Zoom. So thanks
It's
for
okay.
that.
I don't know how to I don't know how to manage my email, Evelyn.
So,
Zoom is
all
advanced. But
right.
anyway,
Well,
thank you and
yeah.
Allah yahmiki.
Allah
Please
يخليك.
stay safe and we're happy to hear from you. We know you're all struggling there, but your
Yeah,
voice,
I'm
your
sorry. I'm
testimony is very
gonna keep
crucial. We
this
needed to
brief
hear
because
you.
I'm on shift, and yesterday they told me about the session, but I broke away
And I'm just going to give a very quick kind of overview of the situation in Lebanon, a little bit of a contrast between the 2024 war and what we're facing now. And then maybe take a couple questions if there's time for that. But so I'm going to just quickly share some quick notes. All right. So just so for those, I'm sure everybody on this meeting, on the Zoom call, is aware that we had the big escalation of war and attacks on Lebanon in 2024, after that started with the pager attack and then lasted for around a couple months, 2.5 months. During that period, we were attacked 12,000 times. We had 4,000 dead, 17,000 injuries overall, with 1,400 war-injured children. Over 1 million displaced, and more than 3,000 buildings were destroyed. Internal displacement. What I learned from that war is not just that there's the issue of casualties and dealing with casualties, but really like the biggest pressure, I think, on the healthcare system is the displaced. And this is what we're seeing from Gaza as well. And when we're talking about direct casualty deaths and indirect deaths, the indirect impact of war on patients and on people is much more of an issue, actually. Not much more of an issue, but the scale of it is much bigger than what the casualty counts are. So, and the extrapolations of, sorry. And that's why the extrapolations on excess death really end up being at least 4 times what the actual direct death counts are. So when we think about the impact of the war of 2024 on the population, we did a small study at AUB, which is the place where the hospital that I'm working at, and looked at the displaced that came to our private hospital. And I'm going to talk a little bit about what the challenge in healthcare is here. But we're a private hospital, so we were lucky enough that we had a supportive administration, and that the fundraised, and we ended up seeing through the donations some displaced. Around 20% of the patients we saw in that month were displaced. And what is clear from our looking at the data is that the criticality of displaced is much higher than the non-displaced. So we did a comparison of displaced versus non-displaced, much higher admissions, much higher critical care admissions. So mortality and outcomes are a lot worse. And that's because these patients have interrupted access to care. Medications are interrupted. So we're seeing oncology patients that are totally severed from their environment and from their regular care, and end up being uprooted and come into the city and come to the closest hospitals to continue care, which also ends up being very fragmented because of the way our healthcare system is set up. So speaking of the healthcare system, I'm just going to mention a little bit about that before I go into attacks on health. So in Lebanon, around 80% of our hospitals are in the private sector. So our private sector is relatively good in terms of expertise, in terms of resources, imaging availability. We have many JCO equivalent organizations, hospitals that are accredited, so standards are quite high, but they are private hospitals. So access to these private hospitals by the population at large, most of the population does not have insurance. I think around 10-13% of the population has insurance to be able to access the care. So there is a total mismatch in where your resources are as a healthcare system and what patients are able to access. And in times of war, what ends up happening is that the government ends up covering care of the first encounter at any hospital the patient arrives. So what that means for casualties and people with trauma is first surgical encounter is covered, but then after that, beyond that, the multiple surgeries that many of these patients end up needing go uncovered. And for displaced, the public hospitals become the designated sites for public hospitals to go to, but they are under-resourced and not enough, and not necessarily in the areas where the populations end up moving to. And this is why we see what we see in terms of many displaced coming into the city and having interrupted care and minimal access to care, because most of the resources and most of the capacity is in the private sector that they're unable to access. The other element or the other phenomenon that we saw in the 2024 war was, of course, the attacks on health. It was basically a replication of what the Israeli army has embedded as part of its routine standard operating procedure, which is attacking healthcare, both facilities as well as healthcare workers and providers. We had a total of 485 attacks on health. 408 healthcare workers were killed during the 2024 war. Many of them the pre-hospital care providers. So how does this compare to 2020? How is 2026 comparing? So we are now a week into it. Displaced are a bit less this time than what the counts were, even though what the evacuation orders that the Israeli army has been messaging are much broader. I'm not sure what's contributing to that. I think part of it is that they're so broad that people don't have places to go. They experienced displacement in 2024 and have decided that they'd rather stay at home than experience that again. So, and then the areas are it's such a wide area that they have issued evacuation orders on that it's just impossible for a quarter of the population to uproot and then move on. So in the city where I live, it feels like there's no real numbers that I have, but it feels like the shelters and the schools that are opening to shelter displaced populations are not as full as they were in the first in 2024. But the casualties are coming in, and they're coming in regularly. We haven't had big mass casualty events, but every day there are 5 to 10 killed, and multiply that by 7 to 10 in terms of casualties that we end up having. Displaced care is still a problem. There are designated, again, the Ministry of Health has designated public hospitals for care of displaced, but they're far not necessarily close to where people are. And again, right now I am working in the ED, and I would say probably 30% to, if not 40% of the patients that I saw today, I've been seeing, are displaced, and they're displaced that are very sick. So they're coming in, the acuity, the reason why I couldn't make it is because the acuity is so high. We have a hydrothorax and a displaced who just wanted to leave AMA after we took out the chest tube because he can't afford care. I have another patient who is coming in psychotic, a 58-year-old diabetic, psychotic, no prior history of psychosis. And I'm looking at his record, never been here before except once, 3 days ago, came in for an earache, but left without being seen because couldn't afford access to the care. Now that he's higher acuity, made it in and probably is meningitis. So this is the level of acuity that we're seeing, all very high and all from either inability to access care or interruptions in care. And again, we're seeing this mismatch between where the need is and then where our resources are, and the way we're set up as a primarily private sector that cannot serve the population as it needs. They cannot meet the demands of the population in times of crisis because of the mismatch in compensated care and uncompensated care. In terms of casualties, so definitely death rate is, I think, certainly going to be much higher than what we were looking at in 2024, because so many people are choosing to stay in their homes. But even at the casualty level, what we're seeing is multiple hospitals in the areas where that are being attacked. Those hospitals have had to evacuate. So the hospitals that can serve the populations that need it the most are the ones that are having to evacuate. Private sector and non-private sector is ending up shouldering some of that load. So definitely an increased burden on those hospitals. The other phenomenon that we're seeing is, I'm going to talk about one bright light, which is the Ghassan Abu Sitta Fund. The Ghassan Abu Sitta Fund was started by Dr. Ghassan Abu Sitta, and it's basically pledges and donations from private and nonprofit organizations And in working with the Ministry of Health, we've had a year and a half of success running this program. So the Ministry of Health has designated the Ghassan Abu Sitta Fund as the primary fund to care for all pediatric patients from 0 to 18, in coordination with some international organizations. So all funding is being channeled to this fund, and through it, we are caring for all the pediatric age patients, which is something that didn't exist in 2024. So as a result, our center has been seeing a lot of the casualties, and we just transported a couple from the peripheral hospitals. And it's good that there is centralization, but it's also showing us how much under-resourced the peripheral hospitals where the attacks are happening mainly are. We're receiving patients that are totally under-resuscitated. There's a really long time to transport patients from the peripheral hospitals to the tertiary care hospitals because many of the pre-hospital care providers are not operating in the areas that are being attacked. So that's also an issue. But this is one good thing, is that at least in this war that there is a provider or there is a mechanism to care for pediatric war injured patients. The total from 2024 was 1,400 pediatric war injured children by the end of the war. During the ceasefire, there was another 70. And this week alone, what we have, I mean, every day we're receiving at least 3 to 4 new injuries. This is the critical ones that are making it to our tertiary care center. So I'm sure there are many more out there that are that are more minor. But at least in terms of critical, we're seeing 2 to 4 a day. So this is the status of the casualties in the 2026 war. Really, the care is primarily peripheral, then coming to central for pediatrics, and for adults, the care remains at the peripheral hospitals where that first encounter is covered. For displaced, as I said, again, the designated public hospitals are the designated centers for displaced, and there are many organizations that are setting up primary health care centers across the country and in areas where the displaced are sheltering. Certainly, this is a lot of this is community-based initiatives and NGOs. Not the Ministry of Health is not able to handle the entire load on its own. So a lot of this is grassroots operated primary healthcare centers. And I will end by just saying that the challenge is big in terms of health, but it is not impossible. I think the fact that the Ghassan Abu Sitta Fund has been able to be an example of how one organization has been able to handle and make room for accessing or opening access to care for all pediatric war injured children is a success story that can be replicated. There is a lot of community initiatives, and these primary care health centers are making a tremendous effort and in trying to meet the demands of the population. And I will say that, you know, the 2024, what was outstanding about it is that it was all community-based initiatives that opened up the shelters, that fed the displaced, that primarily led the primary care centers. So there is a lot of community initiative, but the big difference between 26 and 24 is that Israel has managed to carve out a divide of fear between the displaced and the host communities because of the targeting of displaced who are being sheltered by host communities. So if a family houses someone who's displaced, they will intentionally target that house just as a message that of not to house that particular community. So this is an intentional attempt to try to form a schism between the population and try to fuel internal strife and internal conflict. And I think this is the biggest challenge of 2026. So the more that we can care for the displaced, the more that we can allow the displaced to stay steadfast within where they are, within their shelters or where they are, the more that we can resist against the systematic attempt to ethnically displace and dispossess the population. So thank you. I'll end
Thank you,
there.
Dr. Evelyn. Can you stop sharing, please, so we can talk to you? And thank you for giving us the time. We know you're very busy and you're dealing with catastrophe situation there. For every American here, for every Canadian or Westerner, or if you live in the West, everything Dr. Evelyn Hetty mentioned is not caused by a natural disaster. This is all man-made, this is all intentional, and this is being committed by your government, by your politicians. What she and her people are going through is something we are committing. We need to use our voices and every means possible by any means to stop this catastrophe and this disaster. This should stop. This war, this attack on life, on civilians, this expanding genocide should stop. It is being committed by us, by our governments. We need to do more. We failed the people of Palestine and we're failing more and more. And if genocideers are not stopped, if politicians are not held accountable, this will continue to expand. And the imperial boomerang is coming home. We need to stop. You don't need to wait for this to come at your doorstep. We have to stop it now. And thanks for Evelyn, for her co-workers, for her people, for trying to do everything they can to help. Thanks for Dr. Ghassan Absitta Fund that is able to take care of the children who are victims of this war. We, as DAG, discussed with Dr. Evelyn, we will be taking care of the adults. All displaced community, adult community, displaced community coming to the ER at UOB. We are in the process discussing with Dr. Evelyn and AUB that DAG will be responsible to cover the care and the expenses of all adults of displaced communities coming to AUB. Of course, every hospital there is in need, but at least we have this channel with her now, and we are lucky that she herself will be overseeing this. She's the chief of the emergency department, and inshallah, we are setting up the fund in the next day or two. So please be, be looking for that. We need to help the communities there, especially that they are suffering because of our politicians and our systems. So Dr. Evelyn, we know you're busy, but thank you for giving us the opportunity. If anyone has any questions for Dr. Evelyn, please ask her, and we will be discussing with you, Evelyn, later about how we are setting this fund to take care of the adult community coming to your door. And as you mentioned, AUB is surrounded by a huge number of displaced people coming in that area who lost everything, who lost their homes, their medications, their access to care. So providing care for them is a life-saving undertake. That this is the least we can do as people living in the comfort of the West and not able to stop these crimes. This is the least we can do. Thank you, Dr. Evelyn. Any questions, Karama, Yiping, anyone?
Thank you for putting this into very clear numbers and information. It's, we've seen this video before and we've seen this movie before play in front of us. And what is disturbing is the targeting of the people who help the displaced and the dispossessed. We have seen that also where the hospitals in Gaza have been attacked because they have injured people and displaced people, so they become targets. So we really should rally behind not another hospital, not another patient, not another child, and force our colleagues who have not even given a thought on how to prevent that to do more and organize and be more proactive, because we're seeing it spread all over the world. Israel started this in Gaza and it continues to push this normalization of healthcare attacks everywhere. And we are seeing it in our communities. Like Jamie Sharp said, it's ICE is taking our patients from us. So we have a huge responsibility. Ipeg?
Yeah, I was just wondering to hear a little bit more about the attacks on healthcare facilities, healthcare personnel in Lebanon, because I know that Israel has made this a policy and a practice consistent in Palestine in the context of Gaza, but also we're seeing this in the context of Iran with attacks on hospitals and health facilities. I'm wondering if you could share a little bit more about what's happening in Lebanon with respect to.
Yeah, I mean, it's a good question. What we saw in 2024 is an acceleration of what was happening in Gaza. Because in Gaza, if you remember, they tested the first hospital and then public opinion and response, and then the normalization by everybody, including medical, I think not including, but I would say especially the medical community and the silence of the medical community has had, this is what I think is the biggest culprit in normalizing this. So it became normalized, and there was no outcry, very little outcry. So it happened in a very accelerated. So in 2 months, there were 422 healthcare workers killed. I think in Gaza, in 2.5 years, it was around 1,400, 1,700. And they're using the same tactics, and you're just not hearing about them because it's no longer headlines. So they bomb next to the healthcare facilities. There was that very good article from Harvard on the geospatial analysis of craters next to in proximity to hospitals in Gaza. And essentially what they do is they bomb next to the hospital within lethal range, most of them, if not lethal range, within infrastructure damage range. So basically hospitals end up going out of commission. So that happened regularly in the 2024 war, and it's happening. The difference in Lebanon is that one community in particular is being targeted, and it's the community, the Shia community, essentially. We're more diverse than Gaza, and they're using that to create internal strife and to cause a schism between the communities, so that the Lebanese end up turning against the resisting community. So what we saw is that a lot of the hospitals in those communities got targeted. Right now, this week, the hospitals, and these are big hospitals that shoulder a lot of the healthcare load, ended up having to evacuate this week. So they've shut down and shifted their patients to the other hospitals, which is not ideal, but because they are just lame duck targets. And so this is what we're seeing, and I expect that this is going to happen. It's going to expand much more to more hospitals and more healthcare workers. And what I experienced today is that, there are indirect effects, even if it's not yet very visible in the counts. So we are trying to transfer a patient from the south to our hospital. No one is willing to go and get that patient except for the Red Cross. And the Red Cross is so overwhelmed that it's taking a long time to get patients. So by the time they get to us, they're totally under-resuscitated because of the limited resources in those hospitals. So there are so many indirect impact. There's so much indirect impact on health just from the historical record of attacks, not even yet the attacks that have started. But I'm sure will come, because what I'm hearing from the news from Iran is that already huge attacks on healthcare sites and pre-hospital care workers this past week.
Yeah,
So
thank
I
you,
think,
Adrian.
if I want to just make out one more call, that all of us in our own organizations and the medical community, it needs to start there. If the medical community is silent on this, who do we expect to voice a concern about the total collapse of medical neutrality if physicians are silent on this?
Yeah, thank
So
you.
thank you for the time.
No,
And
don't leave.
yeah,
One more time. So, for the Shia community in Lebanon, in Iran, and anywhere else in the world, from a Sunni Muslim and from a Christian doctor, Dr. Evelyn, and from everyone at DAG with all their faiths, all their religions, or their nationalities, we love you. We will stand with you. We will not leave you alone. So don't be feeling, I know all Shia feel that the whole world is turning against them, and we are not. DAG will not leave you alone. We all stand with you. Thank you.
And I would add, we're very proud of you for your resistance, for your strength, for your bravery, for the hope that you give all of us in that steadfastness. So thank you.
Yes, and thank you for fighting the axis of evil represented by the United States of America and Israel, the axis of genocide in this world and destruction, these empires that are built on sin and on genocide. Dr. Swiyang?
Dr. Lin, thank you so much. You know, it's terrible that we know so little here. We really, you know, the news tell us nothing. Thank you so much for your work and your advocacy. I'm deeply grateful.
Okay, thank you. Thank you
Thank
all.
you. Evelyn, do you
Yeah.
have any estimate of how many thousands of displaced people are just around your hospital at AUB?
The estimate as it stands right now is probably anywhere between 30 to 40,000. Because the area that AUB is in is one of the most diverse areas in Lebanon, so it's one of the most welcoming. So around 30 to 40 but we're talking about a really small neighborhood. If we expand it beyond that, Yani Beirut is very big. I'm just saying the periphery of AUB, like the couple of blocks from AUB, is probably 30 to 40,000.
So
Okay.
please join us and join AUB and Dr. Hitti and their colleagues to take care of these people. This is the least we can do, and we will be sharing with you the links once we finalize them in the next day or two. Thank you. Any more questions for Dr. Evelyn before she goes, please? I know she has to go because she has patients waiting in the ER.
Wallahi, thank you from the bottom of our hearts. You're exemplary. We're honored to have you with us. Shukran.
Thank you all for all your work.
Stay safe. God
Bye.
protect you. Allah yahmikum. Shukran. Thank
Allah
you.
يخليك. Bye.
Inshallah, we'll talk more later. Thank you. And we have Dr. Muhammad Mustafa. He was coming under the banner of Nidal. Dr. Muhammad, are you there? How are you? Dr. Muhammad is an Australian Palestinian ER doctor who has been on many missions to Gaza, and he's here in the United States on a tour, Advocacy Against the Genocide, and to help the communities. We are honored to have him and to hear from him. If you want to share with us a few comments, Dr. Muhammad, we are all listening.
Ahlan, assalamu alaikum. How is everyone doing?
That cannot be Nidal. There's no way. Okay.
I really need to change that. So, assalamu alaikum, everyone. How are you all doing? I know the world seems to be going a bit crazy at the minute, but I've been actually traveling around, not just the United States, but Canada, the UK, Australia in this month of Ramadan. And I've never seen organization like we've seen over the last few weeks. I've never seen a commitment to the cause like we've seen in communities come together from all walks of life. So I'm really excited because I genuinely think we are more organized now than we ever have been before, and we have more political power than we ever have before. So look, I know it seems quite dark right now, but I think we just have to keep going and keep pushing because I really do feel the tide is turning. This is the least popular war ever in the history of the United States in recent modern history. It's polling at around 20%. The injured and the killed in this war is quite huge that we still don't know the numbers by. And I think the other interesting thing as well to remember is that this is not like the Vietnam War. This is an opposition in Iran which is very sophisticated, and this is going to be a long drawn out war. And I feel like that we have to really hold our mark and our territory because we are going to see more and more war crimes being committed over the next few weeks and over the next few days. The war secretary has said that. He said that they're not going to engage in rules of engagement. So I feel like more than ever now, Doctors Against Genocide is such an important organization because really we are watching a new world order unfold.
Thank you. Thank you, Dr. Mustafa. And we look forward to seeing you, inshallah. I'll see you in New York City, but the rest of the team will see you in Washington, D.C. So thank you for your efforts. You have been working nonstop to support and to lift and to spread the word. We appreciate you. And yes, it is least popular. And unfortunately, there is a lot of power pushing this on the world. And we have to match this power with powerful organizing.
Yep,
Yeah.
we do.
Thank you, Dr. Muhammad. As you said, actually, I'm glad you brought this point. It gets darker before the dawn, so we should not be feeling depressed or desperate. We have to keep pushing, and we have to amplify our voices. And I'm sorry again, I missed you in Michigan, but I'll be seeing you in DC and New York, inshallah. So Dr. Muhammad and Dr. Yiping are gonna be joining us for events in New York, DC, March 10th in DC and March 12th in New York. It's going to be a fundraiser and an educational session, mainly dedicated to rebuild Kamal Udwan Hospital. And thank you, Dr. Muhammad, for all what you do. We know it's taking a toll on you. You're all over the place. You're traveling all the time. But
Yeah.
humanity.
I'm sorry. I'm struggling to catch my breath because I arrived in Denver yesterday, and the altitude has really got me.
Oh,
So
wow.
I'm struggling right now with the altitude. I'm getting a bit of altitude sickness. But do you know, look, um, I have traveled to so many different communities over the last few weeks and the last few months. And I have never seen a commitment like I have now. And I've never seen young people come out and support what's going on. And I've never seen groups of doctors come out and organize and be committed to this. I really think that we need to seize the moment right now because I've never seen, like I say, there's so many different doctors from so many different walks of life that are standing together. I know we've seen attacks on hospital become more common, and I know we've seen the media ignore it more and more, but it is having a profound effects on medical professionals, and medical professionals are being radicalized, and they're being radicalized to stand up and to speak out about what's going on. And it is really important that, as tired as I am, as fatigued as we are, it's been a long 2.5 years, that we keep going right now because we really are at a precipice of really seizing this moment and becoming something quite unique. You know, Doctors Against Genocide, this is an organization that started because of the genocide in Gaza, but we are seeing now genocides being committed in Sudan. We are seeing war crimes in Iran. We're seeing ethnic cleansing in Lebanon. We are seeing things going on in Syria and Yemen. This organization now has become more pivotal and more important than ever before. And I really feel that this is only going to grow, and it's going to grow if we keep committed and we stick to our moral principles and we keep marching forward. So I'm really happy that I'm going to be there in Washington, and I'm going to be there in New York. And like I say, we've got to keep pushing and keep building this community.
Thank you. I don't know. It seems Australians have something with language. They're really good at speaking and their accent and all these things. So Dr. Muhammad and we have Dr. Nada joining us now. But we are really grateful. Thank you for all what you do, Muhammad. It does make a difference. And يعطيك العافية. I know you're exhausted, but you are tough. You're the beast from the Middle East. You can do it. If you cannot do it, who else can, huh?
Luckily, thanks.
Yeah. Yeah, thank you. And inshallah, we'll see you and hear from you soon. Go
Yep.
get some rest, and thank you for joining us on a short notice. Now we're joined by your colleague, Dr. Nada Abul Rob. Dr. Nada is also a unique. She has Palestinian roots, she has Iranian roots, and she's Australian. She is an MBBS Doctor of our ACGP. She's a humanitarian physician and Australian general practitioner with advanced skills in emergency medicine, obstetrics, and surgery. She has delivered frontline care in war zones in Gaza, Syria, and Palestinian refugee camps, Aboriginal medical services, and remote and tertiary health settings across Australia and the Middle East. She's combining clinical excellence with lifelong commitment to the vulnerable and displaced populations. And despite the time zone difference, thank you, Nada, for joining us. We are really, we are really honored to hear from you and from your colleagues. It's all yours. Please join with us. Any remarks you have about what is happening in the region, in Lebanon, in Iran. You've been to Gaza, you know what's happening in Gaza, and if you have any reflections on this, you've been to north of Gaza, and you know the north of Gaza has no functioning hospitals at this point, zero. And we know that the communities that Dr. Hussam and his colleagues sacrificed to help and to serve, they don't have any access to care there. and this is actually affecting their choices because many of them are thinking of going back south because they don't have access to care in the north. So, in the legacy of Dr. Hussam, in honoring his sacrifice, we want at least to rebuild the emergency department for the children and the OBGYN sections at this hospital to provide for the children there. And thank you for joining this call to support this action. And it's all yours. And you can be yourself, speak your truth. I think you are in a position to speak the truth of all these communities because you have family roots in everywhere. تفضلي.
Inshallah, inshallah. Thank you so much.
And
Ramadan Kareem for everyone.
you promised to speak some Iranian too, especially when it comes to the discussion about Iran. So we
Yeah,
want to
maybe
hear
at
the
the
facts.
end.
Yes.
I'm not sure if anyone of the panel today speaks Iranian, but I'll talk Iranian at the end, inshallah. Um, you know what's happening now in the world is really heartbreaking that we reach this level. It's almost kind of impossible, the level that the destruction and evil has reached, unfortunately, to the I'm sure, like most of us as doctors, we work full time and we have a lot of responsibilities, and I just find it now hard to keep track of all the basically all the destructions and all the illegal things that are happening, all the crimes that are happening around in our country, especially in the Middle East, which is definitely heartbreaking to watch. But we never should lose hope and for things kind of and keep on continuing to do what we can do to make things get better, because it's easy to lose hope when we see what's happening around. And today is the International Women's Day, and it makes us think that those people who kill women and children, there's no way they'll be the one who will deliver liberation in any way. Those kind of the double standards in what they say and what they do on other countries. It's just I think Gaza was the main reason that opened our eyes and many people's eyes to what actually happening in the entire world, right? When I was in Gaza, I said something. I said, what I noticed is that the people in Gaza are the only free people in the world. And the rest of the world is under occupation, under control. But unfortunately, they're killing them, and that's why they're doing the genocide in Gaza. And it's basically, they just wanna make it basically disappear and not the same as what it was before. But وَيَمْكُرُونَ وَيَمْكُرُ اللَّهُ وَاللَّهُ خَيْرُ الْمَاكِرِينَ. We basically hope that things will be better for them. Now, as half a Palestinian, half Iranian, I think this has put me in a little bit of a complex position, because unfortunately, not everyone will understand where I'm coming from, because I both hear my family in Palestine, in the West Bank, my heart in Gaza, and after I saw the people there, they're my people, and my beloved ones there, and then I speak to my family in Iran for years. So being a pro-Palestinian does not mean that you're not with other people. So humanitarian and basically human rights applies to all and doesn't come with a selective filter. Saying that, in my time in Gaza, I believe no one in the world has suffered as much as the people in Gaza did. And they were basically, we were warning, everyone was saying, like, if we stay silent about what's happening in Gaza, it will basically reach other countries and other places soon. And they reached a level that they were very openly talking about it on TV, that putting a map and saying what basically they're going to control and do. So it was all out there, it wasn't even hidden. But I think people are just numb, maybe, or don't believe until it affects them. But the people in Gaza have seen horrors, if I can say, like the whole buildings falling on an entire family is wiped out. The type of the killing with the drones and targeting kids, like really targeting kids for some reason, and in the fertility centers as well, and incubators. So it was just horrific to watch that in our day and age. This is possible, and on the Western media, where the coverage is so double standard and hypocritic, where it shows this is what they're doing is for liberation, or one side is terrorists and one side, like we've all seen what the situation is really and all of the lies that we lived under, and maybe we as well believed for a long time. So yeah, as I feel the Palestinians' pain, and I always was proud that Iran was one of the few countries, if not sometimes the only country, that stood with the beautiful people of Palestine, which basically, I've always, we shouldn't forget that. And now, you feel everything everywhere else, you feel for them. So what's happening in Gaza as well is now in the West Bank, a lot of things have been happening during the genocide. Yes, the concentration was on the genocide, but my family in the West Bank have been, expelled out of their houses, taken hostages. It's the situation there. They haven't been going to school, haven't been allowed to leave the home. So it's the injustice that you feel is basically applying on the Aboriginal people of the land everywhere. And as an Australian as well, in the history and working with Aboriginals, like, you think that the world would be better now, in talking about apology days and never again, and all these phrases about human rights and international law, but on ground it doesn't apply, or it applies on one side, doesn't apply on the other. Which is a total injustice, and it's not basically a good feeling to have, because it creates that intergenerational trauma that stays inside, whether for Palestinians of the inside or outside. And now in Lebanon, we've seen the genocide and the threats of basically making South Lebanon exactly like Khan Yunis and Gaza, which is basically just outrageous. Like, just to talk about this loudly and imagine this happening to our people there is just so heartbreaking. So yeah, there's a lot kind of we can say, but what I want to as well, talk about, that some will agree with me and some wouldn't, unfortunately, is that with the Iranian people, they have rights too. They do have a right to live in dignity, with good economics, and have a good life without an oppression. And it's like a father who should look at his family first, and then basically help the people out outside. So when the system inside is shaked or have lot of issues, it will basically let the outsiders or the foreigners use this as a weapon for destruction, and basically to expand more. So whether Arabs, Iranians, Muslims, humanitarian people should stand with each other, rather than kind of trying to find the difference between us, and trying kind of to fight or take sides, either or. And in Iran, it's like a big population there. It's more than 90 million people in Iran, and not all of them have the same. They come from different different sub-religions and religions and beliefs, and some people are with the regime or against the regime, or things like this. They don't basically agree on everything. But as an Iranian who went to Iran, have a lot of family in Iran and outside of Iran, some can go back and some are not allowed to go back. It's basically one of the things that been very heartbreaking to me as a you know, as a Muslim, is that to see how, unfortunately, because of the oppression that they were under, a lot of, like, not you know, I can't say all or lots, but like, you know, a good percentage, and I'm sure in America and elsewhere you've seen that a lot of Iranians, unfortunately, have been repelled of the religion, and basically they took the bad idea about it, which is not correct. But you know, you can't just blame the people. You need to kind of to look at the source of why they reached this point, and that's one of the main things that made me angry about the situation in Iran. Plus, you know, they're going through a lot, and they accepted the sanctions. They accepted the sanctions at the beginning. They were like, you know, the people of Iran are very connected to the land and the soil, and you know, they're very proud. They're very proud Iranians, and they stood with the cause, with the Palestinian people, and you know, with all of this. But I think you know, they're looking as well for the support from the people around them as well. And coming as well from a Sunni father and a Shia mom, you know, we're all the same. Like, you know, we're reading the same Quran, we're fasting Ramadan. You know, they're praying kind of the same prayer. Those minute changes are like, you know, are in science, they're kind of a human. Like, you go from somewhere to somewhere else, different accent, different language. In Sunni itself have subdivisions, Shia has subdivisions. So it's just insane to try to, you know, to stand against each other, especially in those hard times, and let the enemies take our land and do all the destruction instead of standing with each other. And it breaks my heart when I hear people you know, after, you know, what Iran has done is just to say Allahumma you, I can't remember the exact phrase, like, you know, اقتل الظالمين بالظالمين وأخرجنا بينهم سالمين. I think a lot of Iranians take it to heart, if that makes sense. So I think we all should, as Muslims and as Arabs, we and as Iranians, we should stand together. We shouldn't always play the victim side. We should stand together and try to basically, you know, see the real enemy in the picture, which is basically the enemy that has now all the, you know, the American bases in all the most of the Arab countries, whether privately or publicly. Unfortunately, it's all under control. So I wish that the situation gets better. I know it's hard. It's not going to be easy. But we don't wanna have an escalation of the amount of death and destruction. Like, it's always the civilians and you know, the innocent people pay the price for all of this, which is very heartbreaking again. And I'll say kind of a little bit of in Iranian that in من یعنی ایمان دارم که این روزهایی که خیلی تاریک هستن برای ایران ما، فلسطین ما، دنیای ما، به امید خدا روشن میشه روشن میشه یه بار دیگه. قلب من با ایران هست، ولی من بازن میدونم، دیدم شکار اسرائیل و امریکا داره کردن برای فلسطینیا، عراقیا، تو سوریه. من میدونم، تو قلبم دیدم و دیدم تو ششام چی شد بریشون. نمیتونم وایسم و بگم که همون کسیا که کردن جنوساید میتونن پیس و زنده بیارن برای ایران ما و برای ایرانیا. نمیتونم این بگم که من قبول ندارم که اینا میتونه زندگی ما بهتر بکنن. بعد ایرانیا دست به دست باشن و بعد انشالله همه یعنی عربا و مسلمونا و همه یعنی با ایران باشن از ول، نه با امریکا و اسرائیل و کسیای دیگه. و inshallah freedom comes from the inside to all people, and light will come soon. I don't know, Dr. Nidal. I have a lot of to say. It's just all sad and, and heartbreaking, unfortunately.
Yeah, thank you. I mean, I'm really happy that you spoke some Iranian. We need to hear the Iranian voice, the Iranian language. We are proud
Thank
of
you.
you and honored to hear your testimony. I have a question for you. You have family in
Yes,
Iran now. You have contacts on the
yes,
ground.
yeah,
And what we hear, the attack, the discriminate, devastating attack on all Iran, the civilian infrastructure, killing the babies and the children in the schools, attacking more than 13 hospitals that we know of.
yeah,
And as you said, while we support the Iranian people's right to democracy, to freedom, to choose their leadership, that can never justify a genocidal power, an imperial power anywhere in the world to attack Iran, destroy the whole country with that excuse. That's never an excuse. We support the Iranian people right themselves to free themselves through their own means, through democracy, through protests, and all these things.
yeah,
But we all know that what Israel and the United States are doing now is not because they care about the Iranian, is not because they care about the people. They actually want to destroy the whole thing. They want to start a civil war. And believe it or not, I mean, they might end up nuking Iran. We're talking about fanatics. We're talking about crazy people. The United States is the only country in the world that did use nuclear weapons. And if this crazy maybe get hurt somehow by a bad attack here or there, miscalculation here and there, he might end up using the nukes too. The other crazies in Israel would not hesitate also. So, I mean, at this point, our focus should be on protecting the people. It is
correct.
not the job of the United States, especially the United States or Israel, to preach or teach other countries democracy. All their attempts before to institute democracy have failed and caused failed state, miserable states, and someone who's committing genocide and exploiting the whole world for their expansion, for their profit, for all these should be the least to come forward and say, "Oh, we were doing this because we care, because of democracy, because the regime there
Yeah,
is terrorist or something." If there is
we've learned
any
our
terrorist,
lesson.
if there is
Yes,
any
we've
terrorist in the world, it is Israel and the United States. Whatever crime Iran committed, whatever crime Hamas committed, whatever crime Venezuela committed, whatever crime North Korea committed, is it's like 0.0. I mean, it's like
in
one out of a
comparison.
million of what the
Yes,
crimes that the United States and Israel are committing it. So if we would not do things on a scale, if Iran did commit bad things, if all these groups, organizations committed bad things that we, of course, we do reject and we are
yeah.
against it, the United States and Israel has committed a million worse. So it is time that we stand against this empire and against their little campaign. So tell us, please, about what you hear from the people there, from your family. How bad is the situation there? How bad is the attack on civilians? What's going on now?
Unfortunately, when we say we want to hear from them, do you know how hard it is to hear from them? Because all the line are just cut, and the internet is shut down. And I have some family in Tehran, my uncle and my grandmother in the north. And at least my uncle knows, like, when he can call us from landline and let us know how things are when he can. But as my grandma, she's an elderly, and you really worry about her when basically she doesn't know what's happening and seeing the destruction. Of course, they're sad to see their country in front of their eyes is being bombed and destroyed. It just they love their country to the bone, and then to see that that's happening is just heartbreaking, of course. And the thing that happened at the school is unbelievable. Like, the whole world should be talking about it. All these innocent little girls and kids, and the way they were killed, and it was basically just hardly talked about in the news. It's just shows you that this is those people, like, who tell you that we're going to bring liberation. Obviously you should be scared of what they're actually bringing. And for me, because I saw what they did to people in Gaza with my own eyes, in schools and to the kids and to the hospitals, those people who have the you know, who can do those crimes and have no heart and no kind of, you know, fear of God to stop them from doing such behaviors, there's no way those people could care about other people or you know, or not do the same. And we learned our lesson of them bringing liberation to Iraq and Syria. Look at, you know, those countries now. They basically, they took all their oil and resources, and they basically created a civil war. But we reached a point that, you know, because we're not united again, that they're even talking about this loudly, that they're going to create a division more between the Muslim people and stuff. So they actually talking about the plan in public now, you know what I mean? So it's out there, and people just, you know, who want to listen and know what's happening, it's not hard to know. Yes, it's a complex situation, but it's not hard to see the truth anymore.
Thank you so much,
Yeah,
Nada.
thank you.
It's
Dr. Swean, you have a question, or Karama?
Yeah, it's just, you know, to reiterate, we stand with the people of Iran, we stand with the women in Iran on the International Day of Women today. And we do not want the Iranians to be bombed but with our tax dollars. We want them to be free. We want them to have self-determination and sovereignty over their own future and over their own land. And just, you know, cheering for the attacks from Israel and USA is just inhumane and against everything that we stand for at Doctors Against Genocide and as humans and as doctors. So just like Dr. Jbour said, this is a message for the Iranian people. We stand in your corner fully and support you fully.
Thank you so much. I want to say I really thank Doctors Against Genocide. Like, you know, their work, I've seen their work on the ground in Gaza, and their ongoing advocation and the amount of help in different ways they delivered is amazing. And now the project of rebuilding Kamal Adwan Hospital is very precious, to be honest, both as basically to bring the help for the kids and the women, but at the same time, because the meaning as well for it. I had the privilege of meeting Dr. Hussam Abu Safia's family, and they're just beautiful people. And as the rest of the people in Gaza, they went through a lot where they lost their new built home, they lost their son, and they went through a lot. But the way that Dr. Hussam, that he was abducted from the hospital, and basically he was definitely a target because we know that they want to silence the truth. Because even as a foreign doctor, I was threatened because I basically started speaking up. So Dr. Hussam was very well spoken with Anas Sharif, which they also killed, and they're just beautiful people, very honest, speak from the heart, showing the truth, and basically taking the risk for their lives and their family lives to help their people in Palestine. And the way he was taken off the hospital, just so illegal in front of everyone's eyes, and he's still in jail and being tortured. And that's very, very, very hard for us as doctors to see, for everyone who knows him, and for his family not knowing what will happen. Like, the whole world is basically unable to stop all these crimes against international law that is happening to Palestinians. So I really hope by now rebuilding the Kamal Adwan Hospital, that inshallah Dr. Hussam will as well be free with the other hostages, and he'll come out and see the hospital rebuilt. That would be a dream coming true.
Yes, inshallah. Please help us with this, everyone. We need to rebuild Dr. Hussam to care for the community that he served for, and we want him to have his hospital back and functioning and operational when he is out with all your help and advocacy. As Nada mentioned, this is insisting on rebuilding the healthcare, the infrastructure, insisting on providing for the survivors of this genocide is by itself the true meaning of medicine. And this is the true resistance to genocide because despite all the difficulties, we refuse to oblige, we refuse to move away, we refuse to leave these survivors at the mercy of the perpetrators. And the least we can do is to support them in every way we can with food, with meals, with shelter, with medications, with rebuilding their institutions. This is the least we can do to give them the means, at least, after all what has been taken care from them, the means so they can survive. So thank you, Dr. Nada. I think Dr. Sui has a question for you. Dr. Suyang.
Yeah, Dr. Nada, you
Hello.
spoke so movingly, and I think the way you are, the way you spoke, your heart is very much like what the Iranian people are. This thing about Shia and Sunni, I must tell you something. I first went to Lebanon 43 years ago. And at that time, the Shia and the Sunnis have got no problems at all. No problems at all. Even the Christians, apart from the Maronites who are very, very anti-Palestinian, we are all together. Nobody asks whether you're Christian or whether you're Muslim, or even Muslim, whether you're Shia or you're Sunni. So all these are made to divide the community. And the dehumanization of Iran is really beyond belief. This is a deliberate effort to dehumanize Iran. The Iranian people have a right to have a country. They have a right to build their nuclear power, although they have a lot of oil. They have a right to protect their country. They have a right to defend the Palestinians when the Palestinians are being genocided. And because of that, of course, people can work up other story and so on. They are being attacked. Of course, unfortunately, they also sit on a lot of oil. And this is all the crime of greed. In Palestine, they wanted to steal the land and rob the Palestinians of the country, steal their land and kill them. In the case of Iraq and Iran and Libya, these countries are unfortunately full of oil and with the people that really never expected to be attacked like that. I heard on the news this morning, this is from BBC, okay? Now, everybody demonizes the Ayatollah. And me being a Christian, I want to stay out of this thing, okay? But I heard on the news that Ayatollah has forbidden Iran to build a nuclear bomb. He said this is a crime against God and humanity. And secondly, he has prohibited the building of missiles that can reach more than 2,000 kilometers. So this alone, you see, makes me feel that we are talking about person. I dare not call him a man because the Shia would say, no, he's a martyr now, who actually understand killing people is a bad thing, which is totally different from the other people that go around the world trying to bring democracy and freedom and so on by attacking and killing whoever who wouldn't listen to them. This is about power, about dominance, about stealing resources, about subduing the people, either displacing them or killing them when they don't get their way. So I think none of us who are watching this webinar should have any illusions about ethics at all. Every government in the whole world have committed crimes against their people to some degree. I myself have done prison in Singapore. But do I actually wish that my government should be bombed and destroyed and replaced? No. The people of Singapore vote. in Iran, the people of Iran vote, right? So this is crazy. This is really a violation of human rights, of international law, and against God. I think we should be seeing it that way. And we
Yeah,
always
it's
feel
crazy.
here.
Yeah, it is crazy. The people who are committing genocide, they're defending human rights. It's just
Yeah.
it's basically sadly funny to hear them talking about human rights after everything that they do. And you said a very nice point that reminded me on the years I lived in the Middle East, where I really never felt the racism and discrimination there, though they call us like a third world countries or developing countries. We all live together, as I said. Like I have a Shia mother, a Sunni dad. I never at the house we felt kind of any difference. I went to a Catholic school, and we were all together. We loved each other. I actually never heard the phrase of white people and black people until I lived in Western countries, because in the Middle East I thought that was kind of ancient in the books and kind of doesn't exist anymore. So yeah, it's sad to see, like, the ones who are actually dividing are coming and destroying the land and taking the oil and basically causing wars inside our region.
Yeah, they have got no right to teach us ethics.
Yeah, I mean, that's always have been the tools of the colonizer: divide and conquer, divide and control. I live in Dearborn, and we have a very significant Lebanese Shia community here, and they really feel devastated. They feel abandoned, and they feel the whole world is turned against the Shia, and for good reason. The crimes being committed against them in Lebanon and Iran are beyond imagination. I've never seen any people who are so heartbroken like we see now. And that's why I'm reiterating my message as a Sunni Muslim, as a Sunni Shia doctor, Dr. Nada, as a Christian doctor, as any doctor, as a Doctors Against Genocide. We are with you. We love you. We will not abandon you.
Thank you.
Please do not feel isolated. And those barbarians, those savages, that axis of evil that's called Israel and the United States, do not have your best interest at heart. They are doing this for exploitation, for expansion, and because they are just bloodthirsty. They keep saying blood libel. It's not blood libel, it's a fact. They cannot stop killing and murdering people. Whenever we feel they stop a war, they start another one. These regimes are a threat to humanity, and I don't think the world will ever see peace until these regimes are dismantled. Um, but again, for the Shia people, please, we are all with you. You are not alone. We will do everything in our capacity to help you, to advocate, to help in any way we can. We know we could not protect Gaza. We know we could not protect Palestine, and maybe we'll not be able to protect Lebanon or Iran, but we will do everything in our power. And I know things are hard and seems very bleaky and getting worse by the day. But as Dr. Muhammad mentioned, as I mentioned, it gets darker before the dawn. We should not quit. And the whole world is waking up. All their lies, all their brainwashing, all their hasbara, decades and decades and decades and billions of misinformation, disinformation, and hasbara and hate and divisions are coming to light, and people are waking up. People, regular average people in the streets, in the schools, in institutions, and inshallah their days, the Epstein class, this ruling class, the warmongers, the ones who profit from mass slaughter, from murder, their days are coming to an end soon. But this will only happen with the help and the mobilization of all of us. We, the people, have the power to change everything and stop everything and strip them of those lethal machines that are killing all of us. Mariam, do you have any questions for Nada? Any comments, please, reflections? Anyone have any questions for Dr. Nada? So thank you again, Nada. I mean, for us, it feels it's really heavy and heartbreaking, uh, and I'm sure it's even much worse for you. It's even more complicated for you. But what's happening now is not complicated. We are against the genocide. We're against the war. We're against killing human beings, regardless. There is no excuse. There is never an excuse to murder, mass slaughter children.
That's not true.
Those lies we will not buy them anymore. Do not tell me you're doing this for the sake of that or the sake of that. No. Mass slaughter of people, of civilians, of children, destroying all their lives, it's never excusable. This should not have been said. We did not need to say that. Mariam, any closing remarks? Our colleagues from Gaza are a little bit late because we started early because of the new time saving here in the United States, but they will join us soon. Dr. Hussam Son is kind of also maybe not responding, maybe because of timing, but inshallah they will join us soon. تفضل Nada.
So if you allow me, I just want to kind of just remind myself and everyone else is to please not forget our people in Gaza with all the everything that is happening in the world. You still can care about more than one thing at the same time and not forget what's happening. Like now, they unfortunately they have to pay the price for everything. So now they close the borders again, and it's you see how they're playing kind of games with people's lives. Like patients are just dying, and I'm working with the team here in Australia to try to evacuate, do the medical evacuation, and it's been hard in every single way you can imagine. And especially like those kids. So we need to push further. We need to make sure that they don't close the borders and they go to starvation again. They basically now all kind of, as you said, they've been expelled from north, and the all these over 1.5 million that is left of the population is living in a very tiny piece of land, overcrowded and tense. But to prevent any help going inside or any medical evacuation to help is basically so unacceptable. No one can live under those circumstances. And yes, we need hopefully to try to help get them out. Unfortunately, a lot of the Western countries that we're in are not even providing the same humanitarian or medical help that is needed for people who are undergoing war, for the people of Gaza. And you see that Gazans people are just basically treated with different rules everywhere. So we need to support them at least to get them treated and get the aid going in so the doctors in Gaza can help them. I just don't want them to be forgotten. They feel sometimes they get forgotten. I want to say that we our hearts are always with them. Yes, we now kind of we have to go and help in Lebanon and Iran and everywhere, but we never forget as well what's happening in the West Bank or Gaza or them.
Thank you.
So you need to help us rebuild Kamal Adwan Hospital so Dr. Nada and all of us can go
Oh,
there
that
and
would be
start
a big
working there.
privilege.
Start working there while
Yeah,
we
I know.
wait for Dr. Hussam to come, and we will be
Celebrate
celebrating
together.
his release from Kamal Adwan Hospital. Please do not forget, the link is in the
Inshallah.
chat. Please donate to rebuild Kamal Adwan Hospital. His colleagues will be joining us soon. Dr. Sakhar Hamad is the acting director of Kamal Adwan Hospital. Again, they are a little bit late because of the timing difference. And Mr. Faris Afani, he's a board member of the Kamal Adwan committee or institution. They will be joining us soon. Elias, the son of Dr. Hussam, hopefully will be joining us. But again, we got a little bit messed up because of time saving. But
Please
please,
send my
to honor.
regards to them. I actually have to, have suhoor. I have 5 minutes left for suhoor, and then I'll have to get ready to go to work shortly. So unfortunately, I can't stay for the rest of the meeting because of the time difference. But please send my my regards and best wishes, and inshallah we'll catch up on another webinar as well.
Yeah, we
Yeah.
always be with you, okay?
Thank you,
Thank you
Nada.
so
Thank you
much.
for
Thank
joining
you.
us. Your truth, your voice is exactly what we needed to hear.
Thank you.
So much appreciated. Go to work, make a lot of money so you can
So
afford
I
to go
can
to
come
Gaza,
back.
afford to go to Gaza and work for free there for a few months. So thank you.
Inshallah,
Salam.
inshallah.
Ma
Oh,
salam.
sorry, Dr.
Yes.
Nidal. I
Yeah.
just remember about the flotilla. The flotilla this time, because
Yeah.
I'm going
Tell
to
us
an
about the
event to
flotilla. Yeah.
support it. Yes, so this time, hopefully, if they go ahead, inshallah, they go ahead by the end of the month. Apparently, more than 700 boats are sailing, and they need doctors to go along. And with joining the flotilla, you don't need the permission. Of the occupation, which is I think hopefully will encourage a lot of Palestinians of the outside and a lot of Arabs and Muslim from the outside and everyone to be able to join those flotilla movement. Yes, we know that most likely they'll stop them as they usually do, but every time they stop them, they're coming back stronger and with a bigger number, which is amazing because that tell you not to lose hope. So yeah, I think we should as well support their mission as well.
Yes, the organization for the flotilla, I think it's going to be sometime in April. So the time is coming, is coming
Yeah,
fast.
late
Go ahead.
March, early April.
Exactly, late March,
Yeah.
early April. So please, anyone, that's a good call for more people to join. I think they're going to have a whole exclusive ship for medical and healthcare,
Yeah.
people to be there. And the last time they did the flotilla, it has a huge global impact. It really helped. One of the main things that helped or forced them to do the ceasefire. And I think this one is going to be as impactful, especially when the attention of the world is going away from Gaza, as Dr. Abu Rob mentioned. We need to bring and refocus the attention because Gaza is like the microscope where all the ills of this world are being practiced. So we need to always refocus on Gaza because we know that if we can free Gaza, if we can liberate Gaza, if we can dismantle the system that destroyed Gaza, these are the same systems that are going, spreading havoc and destruction all over the world. Not because we are Palestinians and we want to focus about our people, but because we truly believe that these systems that are causing all evil in the world are the ones that are focused or causing the most destruction in Gaza. So Gaza is gonna free all of us, is gonna educate all of us and liberate all of us, and at the same time advocate for other communities in Lebanon, in Iran, in the Middle East, in Sudan, in Congo, in Rohingya, Myanmar, for Aboriginal people, the native people, the immigrants in the United States, the marginalized communities, our black brothers and sisters. So thank you, Dr. Abu Rob. Thank you
Thank
for giving
you.
us the time. Enjoy the rest of your day. Thank you.
Inshallah. Thank you. Good night.
Salam.
Bye. Bye.
Yeah, so I also wanted to talk about Cuba and that our friend Medea Benjamin was here on the webinar and she spoke about the medical mission to Cuba. We will try to put more information, but the idea is to bring medications and bring supplies to Cuba that has been under brutal, really lethal siege where even electricity has not been the country has not been able to provide electricity because of the oil embargo on them. So the medical professionals from Cuba have also been banned from going to other Latin America countries like Ecuador. So it is another crisis, another manufactured humanitarian crisis that's being done by a capitalist system that sees human life as disposable. So eyes on Cuba. I want to also give an update on Congo. Our colleagues from Congo are busy, but so they will not be able to come, but they have been able to provide medications, provide simple wound care. Can you see my screen? To
Yes,
the
yes.
communities in Goma. And I just wanted to share with you, this is some of the work that they have done. These we provide them monthly funds to help them do the work in their communities, and they are staffed by doctors, nurses, and this is a simple wound dressing, simple medications that are essential. And these are our partners in Goma that we hope that we will meet one day. And they also provided care, female hygiene kits for women and young women. And that is, as much as we think of it as ordinary in Congo, it's a tremendous help for these young women to actually have access to hygiene kits. So thank you everyone who supports us. Thank you for making this work possible. Truly, it's a group effort. We at Doctors Against Genocide, we work together, and we work to help our fellow humans, to help our fellow colleagues take care of their communities the way they see fit. As always, Doctors Against Genocide is education, aid, and community support. And every day we live this and we refuse to look away. So thank you, and we will drop the link for the Congo donations as well. Yeah, it's a little bit slow today because we are again we lost 1 hour, and
No, not slow anymore. The people in Gaza are joining us now.
oh,
Thank God. They
خلاص, we
just
picked
called
up
me.
speed معناته.
So yeah, exactly. I always get worried but
Good.
I understand their situation. So Paris and Dr.
Nidal is
Safar
on top of it.
Yeah, I was calling them. So they are joining, inshallah, soon.
Yeah, I thought I was an hour late.
It's all Daniel's fault. The capital of the capitalists in the world.
What?
New York is the capital of the capitalists on the world.
It's
Is this
all
what they
Daniel's
say?
fault.
It's all Daniel's fault, yeah. Although Mamdani is there. And I really like the comment from some Iranian commentator or politician who said, when Trump said, I want to change, I want to choose the leader of Iran, they said, if you cannot choose the mayor of New York, how do you think you'll, you'll be able to choose the leader of Iran? Just, I mean,
مين انت؟
psychopathy is an illness,
مين
seriously.
انت؟
Psychopathy is an illness. He thinks he's God or he's the world. And yesterday they had him in the White House and praying on him all these Christian
That was
Zionist
something to be
things,
seen.
and
Wow.
Jesus, you're bringing Jesus and all this. I mean, imagine yourself being led by leaders and politicians and a country that's being led by this. It's okay to mass slaughter maybe 500 million people in the region just for the Messiah to come. I mean, what kind of Messiah is this? Are you talking about a war criminal? I mean, did he put this condition like do you have to commit genocide, kill 500 million human beings before I can come? I mean, do they even have, do they even listen to themselves? Like our Messiah will not come until we destroy the whole region and cleanse it of everyone and just leave the Israelis there. Then he will come and we'll put a red carpet for him. And I mean, the Messiah, all what we know, is the one who said, protect your neighbors, protect the poor. I'm the prophet of the poor. I'm the defender of the poor, of the immigrants and stuff like that. So I don't know what kind of religion they believe in, Trump and his gang of psychopaths in the U.S. Regime. So anyone has any comments, please, while our colleagues from Gaza are
وينهم؟
joining? I hope they're...
I think, Dr. Nada, like I was still trying to formulate my thoughts when she was speaking, but I think it's really brave that she came on and said what she did, because what we've seen from the Iranian diaspora, the monarchist Zionist group of them, which are the loudest and most visible, is that she is probably going to be subjected to an intense, you know, social media harassment campaign, because that's what you see when they come out. Because the most visible and most vocal are anti-Arab, they're anti-Muslim, they're essentially a fascist group of people who are cheering on the destruction of their homeland. So props to her. I mean, she's, given how vocal she's been about what she witnessed in Gaza, she's definitely not a stranger to online harassment, but this time it's going to be coming from her own people as well. So I do appreciate how brave she was in speaking that truth.
She's a doctor against genocide.
Yeah.
Have to be brave.
Yeah.
They are really
And-
nasty, I can tell you.
Yeah, I mean, and just to be clear, I mean, no one is approving of what has happened, the repression in Iran and
No, we are not.
destruction of, the assaults on the people in the streets. No one likes to see that.
Yeah.
It's something that's brutal, and I think we all spoke up against it. We had one
Yes.
of the most prominent journalists in Iranian journalists speak up against the repression by the regime of its own people. But that should never be manufactured consent for the wholesale destruction of the whole country.
Yeah.
And it's inconceivable that anyone would cheer for Israel and the US to bomb Iran and Tehran and the cities, the big historic cities in Iran.
I mean, the people who are cheering this on still have completely lost touch with reality,
It's unbelievable.
You still see it, right? Like, some of our members shared footage of the protest they went to in DC, and you're still seeing the Israeli flag
Yeah.
being waved, and people are still cheering. I mean, there's people cheering for, like, we're seeing like this, it looks like a hellscape, right? When they bombed the oil refineries, and now all of these chemicals are in the water, and the water in the sewers are on fire. It looks like some Dante's Inferno sort of situation. There are people cheering this on, calling it a rescue operation. And yeah, I'm not to speak for the Iranians, but my family's from Afghanistan, so like we are no stranger to Western intervention, thinking that they're going to come and save you, and then they abandon you. Like there's no freedom.
In a much worse
There's no freedom to be found here.
situation.
It becomes a smash and grab, and then they
Yeah.
just leave you if you're lucky, in the same circumstances or worse. And
much worse.
Always worse.
and so every place that you've seen, Iraq, Syria, Afghanistan, like no one's been liberated. No one. It's not the point, right? As Dr. Nada said, the hypocrisy of coming out and talking to us about human rights and women's rights, knowing that you have obliterated Gaza's women and children and the vulnerable and the elderly. It's like you don't know if you want to
Until
laugh
next
or
time.
cry from the hypocrisy of it. So
Actually, yesterday,
there's-
yesterday before she came, she said, just be careful, because when I talk about Iran, everyone will hate me. When I say this, I have people attacking me from one side. When I say this, they have people attacking her from one side. And her father is on one side, her mother on one side, but I'm going to say my truth as a doctor, as a human being.
yeah.
We told her exactly, this is what exactly we need to hear.
It's the vocal
So-
minority, it's whose voices are elevated, who's coming on to the Piers Morgan show and laughing about this.
Yeah.
Like that's always important to keep in mind, is whose voice is being given a platform.
Absolutely.
Certainly not the people in Iran.
And
No.
if you see the protests of people in Iran against this attack on Iran, you're seeing protests in millions of people
You're
are coming to the
uniting.
street despite the bombing. They are in the street to
Yeah.
mourn their lost ones and
Yeah.
to speak against this genocide. While you see a protest here of 10 people, semi-nude and naked, unfortunately, and holding Israeli flags and claiming to be the true bloodline of Iran. I'm sorry, it's really
I mean, people are uniting internally,
Yeah.
right? You know, like the US is going in and saying, oh, we're now going to arm the Kurds or try and encourage them, you know, because they want to do balkanization. I'm like, you abandoned the Kurds. Like, we all saw you guys do this. Like, you used them as allies and then you left them to die. And now you think they also didn't learn from, you know, prior experiences. People are uniting. Like, when you're digging out dead schoolgirls from the rubble, no one is asking, did you back the regime or were you anti-regime? They're mourning over their own people. And like, that's what the administration fails to understand, that when you destroy the homeland, people will unite because you now have this enemy coming in from the outside. Like, nothing is there's to say that they underestimated the consequences of their actions is like, it doesn't even capture what they have done. And so, yeah, you're only seeing these people, you know, in Farsi, you call them Watan Furush, the people who sell their homeland. That's who you see speaking in the US, but that's not the situation in Iran. It's not the situation in any of these countries.
Yeah, thank you. So our colleagues from Gaza just joined. We have Dr. Sakhr Hamad, or Hamad. He's the acting director of Kamal Adwan Hospital, and we have our colleague Faris Afani. He's a board member of Kamal Adwan Hospital. They're gonna share with us updates on the project there. They do have some changes in the plan, but again, the work continues. The goal is still to rebuild the hospital, but they're gonna share with us their updates. دكتور صخر ده ابو حمزه، اهلا وسهلا فيكم، تفضلوا. just unmute، افتحوا المايك عشان نسمعكم. الله يخليكم. most probably they're gonna speak in Arabic and I'll translate. تفضل دكتور صخر.
حياكم الله. الله يجزيكم الخير ويبارك فيكم. تشرفنا فيكم جميعا إن شاء رب العالمين.
So Dr.
معكم
Sakhr, first of all, Dr. Sakhr is a surgeon. He's a GI surgeon. He worked at Kamal
General
Adwan,
surgeon.
executive director. ايش يا دكتور صخر؟
حياكم الله يا سيدي. احنا حبينا نحييكم ونشكركم على هذا اللقاء الطيب. بداية يعني كل بلقبه واسمه. هذا بداية. الأمر الآخر، احنا الآن في صدد ترميم جزئي لمستشفى كمال عدوان. الآن في عندنا احنا مؤسسة بلشت تقريبا في ترميم الاستقبال العام والاستقبال والعيادات الخارجية. حيمتد معاهم الاستقبال النساء والولادة زائد النساء الاستقبال الأطفال. هذا بالنسبة لمؤسسة الآن. لكن احنا الآن في صدد ترميم اللي هو قسم الدكتور حسام أبو صفية، قسم الأطفال كاملة. الحضانة والرعاية الأولية للأطفال زائد العناية المركزة، قسم الدكتور حسام كاملة. فإحنا الآن في حاجة لترميم الطابق الأول زائد الثاني زائد الثالث، اللي هو بنسميه إحنا قسم أو مبنى الدكتور حسام أبو صفية.
اوكي، خلينا اترجم. الله يخليك على اساس.
تمام.
So Dr. Sakhr, first of all, is thanking all of you for your support and for the opportunity. Again, he's the acting director of Kamal Adwan Hospital. He's a general and trauma surgeon in Gaza. What he's sharing is there is another organization trying to help rebuild the hospital. It's called Helping Hand. The plan of that organization, in the beginning, they offered to rebuild the general or adult emergency room because the funds that they had was enough for this, and for us to rebuild the pediatric and the OBGYN emergency department. It seems yesterday they had another meeting with them, and that organization, the Helping Hand, offered to rebuild all the emergency room, including the pediatric and the OBGYN units. So just to be very transparent for you, there is some change in the project. So the Helping Hand is going to do all this part. For us, DAG, our job or our project has changed, and now we will be rebuilding Dr. Hussam pediatric ward itself and the neonatal department. So we're going to change our campaign, the language, to reflect this change. Again, things in Gaza change all the time. Things are fluid. We always try to work on the go, and whenever we get help from anyone here and there, they adjust their plans. So the part that Dr. Against Genocide is going, according to what Doctor is sharing now, actually this is the first time I hear it myself. Seems they had a meeting last night, so I was not aware. So it's not going to be the emergency department. There is another organization that will doing this. What we are going to be responsible for rebuilding is Dr. Hussam ward itself, the pediatric ward and the NICU. تفضل دكتور صخر.
حياكم الله. طبعا احنا اللي بنتحدث فيه تقريبا هو قسم الدكتور حسام كاملة، ومبنى الدكتور حسام عبارة عن 3 طوابق. هو كان الطابق الأرضي هو عبارة عن الاستقبال، الطابق الأول كان عبارة عن مبيت أطفال زائد حضانة، الطابق الثاني عبارة كان عن الاي سي يو، الطابق الثالث هو كان ايش مبنى الدكتور حسام ومكتب إدارته وكذا. فإحنا يعني نلجأ إليكم إن شاء رب العالمين بعد الله عز وجل إنكم تساعدونا في هذا الترميم وننجزه بأسرع وقت، لأنه إحنا في أي لحظة خلال يعني قبل العيد إن شاء الله رب العالمين بأيام سنفتتح قسم الطوارئ، لكن إحنا بحاجة أن نفتتح قسم الدكتور حسام كاملة يعني خلال شهر ما بعد العيد إن شاء رب العالمين. فإحنا بنطالب منكم جهدكم معنا إن شاء رب العالمين.
So the Kamal Adwan Hospital used to have 3 or 4 floors. The first one was the emergency room, which has general reception, pediatric, and OBGYN. Thankfully, the other organization is going to be taking care of that. The second floor was the pediatric department and NICU. Actually, no, the pediatric department. The third one was the NICU. The fourth one was the administration floor for Dr. Hussam. So our project just moved to be covering the, rebuilding the pediatric ward, which is as important. The whole work needs to be done, and their plan is to be able to reopen the emergency room by the end of Ramadan, or maybe a little bit after, and to be able to reopen the pediatric unit in a month or 6 weeks time with all your help. تفضل.
حياكم الله. فالأمر لكم إن شاء رب العالمين، يعني الأمر لكم والقرار لكم يعني، ونسأل الله عز وجل أنكم تساعدوا معنا وتساهموا معنا في هذا الأمر إن شاء رب العالمين. يعني إحنا ننتظر رأيكم وجهدكم إن شاء الله. أبو حمزة. أترك الكلمة لأخونا أبو حمزة.
In general, and he's saying that it's up to you if you're interested to join or this change in the plans. I mean, our motto in DAG, we never say no to Gaza, and we never say no to the victims that are impacted. Whatever they tell us they need, whatever their plans, whatever works best for them is something that we're very happy to support. So it's okay. We know you are working in unimaginable circumstances and the plans change every day. But we have the luxury here, being in the West, that that is an easy thing for us to do, or should be an easy thing. We can readjust and help إن شاء الله. تفضل دكتور، تفضل أبو حمزة، تفضل.
السلام عليكم، كيف حالكم جميعا؟
أهلا وسهلا، كل الناس هنا بيستنوا فيك، بينتظروا فيك أبو حمزة، تفضل.
كل عام وانتم بخير جميعا، دكتور نضال وزملائك حول العالم، أطباء ضد الإبادة. يعني أنا بحب قبل ما أبدأ يعني أتقدم برسالة شكر من يعني خارجة من القلب، يعني صراحة من قلب قطاع غزة لأهلنا وأحبتنا في مؤسسة أطباء ضد الإبادة الجماعية، الذين لهم بصمات واضحة صراحة في الوقوف بجانب المنظومة الصحية في قطاع غزة، وبجانب أبناء شعبنا الفلسطيني بشكل عام داخل هذا القطاع. فكل الحب وكل الشكر وكل التقدير لكم يا دكتور نضال.
Thank you أبو حمزة. أبو حمزة is starting by saying كل عام وأنتم بخير, and thanking all of you, everyone here on the panel, everyone listening, all the supporters of justice at Palestine, and all the ones who are supporting the work that DAG is doing in Gaza. He's saying that whatever we in DAG and many other organizations are doing to Gaza is making an impact, and all this work, all this support is a much needed support. This is the least we can do to support the communities that has went or underwent and suffered a genocide the last 2-3 years at the hands of our governments, providing the support that they need at least to survive and to have their institutions, their hospitals, is a means of survival. It is a means of combating genocide and its aftermath. And if DAG and many other organizations do not stand with the people in Gaza or any community impacted in the world. We are just leaving them at the mercy of the perpetrators to uh, to induce more harm and more suffering and to break their soul, to break their resilience. So please keep supporting, keep pushing, and keep helping the impacted communities. تفضل.
يعني يعني مرة ثانية كل شباب الإسعاف والدفاع المدني صراحة خلال هذا المشروع اللي قدمتوه لنا تكريم هؤلاء الأبطال ضباط الإسعاف ورجال الدفاع المدني ل 300 واحد في شمال قطاع غزة. كلهم بواصلوا تحياتهم لكم على هذا المجهود العظيم وعلى هذا المجهود الكبير. كل الاحترام والتقدير. وأيضا يعني مشروع صيانة مركبات الإسعاف، نكون واضحين وصريحين دكتور نضال، لولا هذا المشروع بعد فضل الله عز وجل توقفت هذه المركبات. كما يعلم الجميع المركبات التي نعمل عليها مركبات متهالكة لا تصلح للعمل، ولكن بفضل جهودكم دكتور نضال بفضل الله يعني مدنا ما يقارب لشهرين في الأمام للعمل على هذه المركبات بعد ترميم وإصلاح وعمل صيانة يعني لهذه المركبات. شكرا كثير لكم يعني.
So Abu Hamza is also thanking DAG and its supporters for helping them to fix the ambulances that they have because they were in very bad shape. They have been using them for more than 2 years under very extreme and very busy, exhausting conditions. They were in terrible shape. And since Israel continued to this day not to allow new ambulances and vehicles to come from outside, the help we provided to repair these vehicles and try to put them in a decent shape, at least to continue functioning, is something that they are very appreciative of and very thankful for. And again, these are old vehicles, and unfortunately, because we don't have other choices, we have to keep the maintenance for them, which is very pricey, very expensive. But without them, things will get much worse because they only have 2 or 3 remaining vehicles that they want to try to keep them running as the only vehicles available in the north that are helping the communities there. تفضل.
انا بدي يعني انا يعني في شغلات كثير بدنا نحكيها دكتور نضال صراحه، بس بعرفش قديش معي الوقت انا عشان نخش في موضوع كمال عدوان.
تفضل
في
براحتك.
شغلات.
تفضل.
فانا يعني كمان يعني بحب اتشكركم كمان يا دكتور على دعمكم للمركز الشهيد الدكتور محمد الشبات، التي صراحه هذا المركز يعد من المراكز المتطوره والمراكز الاولى التي عملت في شمال قطاع غزه في ظل انعدام المستشفيات، في ظل عدم قدرتنا تشغيل أي مستشفى في شمال قطاع غزة. أنتم من وقفتم بجانبنا من خلال هذا المركز الطبي، والذي يقدم للآلاف من المرضى والجرحى وكبار السن داخل هذا المركز. في شهر واحد 12,000 خدمة قدم هذا المركز، وشهر اثنين ما يقارب 11,500 خدمة تم تقديمها من خلال هذا المركز، من خلال عدة التخصصات الموجودة في هذا المركز. فشكرا لكم كثير على هذا جهدكم، على هذا العطاء. حياكم الله.
Abu Hamza is also thanking DAG and its supporters for their help in establishing this multi-center medical point that he is running in the north of the Jubalia camp. And actually it is the only one in the area. It's been running for about two months now, or 2.5 months. DAG was one of the main supporters of the center. In the month of January, they provided 12,000 medical services to the communities there. In the month of February, they provided 11,500. DAG helped funded digging a well at that center so they have access to water. It funded building of the tents that they are using there. We are funding the employees. We supported them with medications. DAG is paying about $20,000 a month for salaries because this center has multiple doctors and multiple specialties. They have a pediatric specialist, they have an OBGYN specialist, they have an ENT specialist, they have an ophthalmologist, They have general medicine doctors working in their ER there. They also have a physical rehab or physical therapy and rehab. They're providing OBGYN care in addition to the ambulance service at that unit. We are purchasing almost $10,000 of medication to be given and used for free for the people who come there because we know they cannot afford medications. We are also sponsoring the mobile wound clinic team that is based off that center and goes to the displaced individuals who have severe trauma and have wounds, chronic wounds that are not healing. They go to their houses, to their tents to provide wound dressing and care and medications. And again, we're happy, we're honored that we were the main supporters of this project and we continue to be. And we need your support, honestly, to continue helping Abu Hamza and his team and our community there. تفضل.
يعني أنا سأبدأ حديثي عن كمال عدوان إن شاء الله وإعادة ترميم كمال عدوان الطبي بإذن الله بجهودكم أطباء ضد الإبادة الجماعية. سنرمم هذا المستشفى حتى نستقبل بإذن الله عن قريب العاجل الدكتور حسام أبو صفية داخل المستشفى كمال عدوان الطبي بإذن الله.
And he's thanking all of you for taking the initiative to help in the rebuilding of Kamal Udwan Hospital. And they have a goal to rebuild this hospital, or at least parts of it, in a month or two. And they are hoping that the hospital will be running and functional and providing services for the community there. And inshallah, when Dr. Hussam is released, he will come back to his hospital as it was with full function. And again, there are some changes in the plans, but that's fine. It's okay. We have to be flexible. We have to work with the people there. Unfortunately, they are working under extreme circumstances. That group, is it Helping Hand? ايش اسمها الجمعية اللي بتبني في الامرجنسي روم يا ابو حمزة؟ Helping Hand.
يد العون. يد العون.
يد العون. Yeah, the Helping Hand. Initially, they committed to build just the general emergency room, and they did not have the fund to do the pediatric and the OBGYN rooms. So the plan, Abu Hamza and Dr. Sakhir came for us. So the plan was for us to take this part. So they take half the emergency room, they rebuild it, and we rebuild the other half. It seems that Yad al-Aun, the Helping Hand, changed their mind, and it seems they do have enough funds to cover the whole rebuilding of the emergency room, which is great. The more, the better. And our project, we're gonna, change the wording of our project, is going to build the pediatric unit, Dr. Hussam Safia unit itself, and the NICU unit that we used to see him on the video taking care of the children there, which is even actually in a symbolic way even more important. So تفضل أبو دكتور حسام دكتور فارس.
إن شاء الله إن شاء الله أنا بعرف إنه اللقاء هذا مسجل إن شاء الله يا دكتور. بذكركم في هذا اللقاء إن شاء الله كل ثقة بالله عز وجل إنه الدكتور حسام إن شاء الله سيعود إلى عمله بالقريب العاجل بالغصب عن الاحتلال إن شاء الله رب العالمين. حيطلع من السجن ويكمل شغله في كمال عدوان إن شاء الله.
So Abu Hamza is saying, mark my word, that is a promise from the people of Gaza that Dr. Hussam will be released despite of Israel and will come back to Kamal Udwan, a fully functioning Kamal Udwan, despite of Israel, despite of the United States, and despite of Trump. Thank you.
لذلك يعني احنا أهمية مجمع كمال عدوان الطبي له رمزية أمام العالم بأجمع، وشاهد العالم وحشية الاحتلال الإسرائيلي كيف كان يتعامل مع مجمع كمال عدوان الطبي عندما كان يخرج الدكتور حسام أبو صفية إلى الإعلام على الجزيرة وباقي القنوات الدولية والعربية والأجنبية، وعندما كان يناشد العالم بوقف هذا الاعتداء على مجمع كمال عدوان الطبي وقتل المرافقين والمسعفين وضباط الإسعاف والاجتياح والاقتحام لهذا مجمع كمال عدوان الطبي. لذلك نحن كالدكتور صخر حمد الذي حمل راية الدكتور حسام أبو صفية مصرين على أن نعيد الحياة لهذا المستشفى الوحيد حاليا. عندما يعمل هذا المستشفى إن شاء الله بعد عيد الفطر، يعد هذا المستشفى الوحيد في شمال قطاع غزة الذي يعمل. ونحن كما تحدثنا قبل ذلك دكتور نضال، الاحتلال الإسرائيلي يدمر ونحن نعمر. هذه المنظومة الإنسانية.
So the importance of Kamal Udwan is trifold. Trifold. First of all, it is the only hospital left in the north of Gaza. There is no functioning hospital in the north of Gaza. There were three of them: Kamal Udwan, the Al Auda Hospital, and the Indonesian hospital. The Indonesian hospital and Al Auda hospital are completely out of service and destroyed, and they are still in the yellow area that is under Israeli control. The only hospital which is still not functional, Kamal Udwan, that is on the Palestinian side or does have access to the community there is Kamal Udwan. So, since there is no functional hospital in the north, rebuilding this hospital is very crucial, very important, because that's the only option we have in the north. The second thing is, or the importance for rebuilding Kamal Udwan is, we know that the genociders, part of their plan or part of their tools to commit genocide is medicide, which is to destroy the healthcare infrastructure, to break people, and to force them to leave. Many people who were able to come back to the north after the ceasefire have no access to care now, and it's making them feel unsafe and making some of them think about going back down south because they have no access to care. So by rebuilding the hospital, by telling people you do have access to care in the north, we are helping the victims to go back to their homes, to their regions. So in a way that is a resistance to the plan of the genocidal, planners and genociders. The third fold or important Kamal Adwan is the symbolic one, because we all have been witnessing to the barbarians and the savages destroy the hospital, destroy the people around it, destroy the ambulances, attack the healthcare workers, and abducting them illegally. And we saw from the videos at that time and the videos we shared now, the devastation, the complete devastation that they committed against this hospital. So the symbolism of rebuilding this is very important. It's very crucial. It gives the people access to care, but it also gives them the confidence that despite what all Israel has done, they can still rebuild, and they insist on rebuilding. And with the help of all of you, we can make this possible. Our colleagues on the ground are doing everything they can, despite the difficulty, despite the lack of means, despite the security concerns. They are willing to do the work. They just need our support. تفضل.
حبيبنا دكتور، إن شاء الله رب العالمين، يعني كما تحدثت هناك الآلاف من النازحين عادوا إلى شمال قطاع غزة. طبعا وجدوا قطاع غزة مدمرا عن بكرة أبيه. لا يوجد مدرسة، لا يوجد مستوصف أو مركز صحي، لا يوجد مستشفى في شمال قطاع غزة. البنية التحتية مدمرة، لكن الحمد لله رب العالمين بعزيمة هؤلاء الناس وبعزيمة المخلصين أمثالكم، أطباء ضد الإبادة، الحمد لله يعني تدريجيا تعود الحياة. هناك الآلاف من أبناء شعبنا الفلسطيني، منطقة بيت لاهية، منطقة مشروع بيت لاهية، منطقة معسكر جباليا البلد، منطقة بئر النعجة، كل هذه المناطق عادت إلى شمال قطاع غزة، ولكن للأسف الشديد بلا مستشفيات كما تحدثنا، بلا مراكز صحية. والحمد لله رب العالمين كما تحدثنا بجهودكم تم إنشاء هذا المركز، ونقدم الآن يعني للآلاف من هذه الخدمات المتنوعة، ولكن هذا الشيء لا يكفي ولا يغني عن وجود مستشفى واحد في شمال قطاع غزة.
So
Nidal, you are muted.
Oh, sorry, I was not muted, didn't mute myself. So to reiterate, what Abu Hamza is saying, that tens of thousands of people managed to go back to the north after the ceasefire. but they found it completely destroyed. Their homes, their infrastructure, and even their hospitals. They have no function. I want to emphasize this. There is no functioning hospital in the north of Gaza. Zero. The three of them that were there, the Indonesian and Al Auda, are destroyed and they are beyond access to the Palestinian people because they are outside the yellow line. The only one that is still inside the yellow line that the Palestinian people have access to is Kamal Udwan. So please, we need your support. They are willing to do the work, but they need our support to give them the means to rebuild the hospital because the communities there, they do need access to care. For them, this is a means of survival, and it's a means of the it's a means of resisting Israel plans and attempts for ethnic cleansing and for evacuation of the north of Gaza. So it's really we cannot overemphasize the importance of supporting our people to rebuild their infrastructure, especially the healthcare sector. تفضل.
يعني اليوم يا دكتور نضال والكلام للزملاء جميعا، اليوم يعني يوميا هناك خروقات من قبل الاحتلال الإسرائيلي وإطلاق النار العشوائي من قبل الرافعات ومن قبل القناصة والكواد كابتر، ويتم إصابة عدد من أبناء شعبنا الفلسطيني في شمال قطاع غزة، وخاصة في مناطق مثل مناطق بيت لاهيا. اليوم تم نقل إصابة طلق ناري في البطن، هذا تم نقله من بيت لاهيا إلى مجمع الشفاء الطبي، وهذا يستغرق وقتا طويلا في مركبة الإسعاف. حتى مركبة الإسعاف لا تستطيع الإسراع كثيرا على الطرقات والبنية التحتية المدمرة، لذلك كما تحدثت يأخذ وقتا طويلا. كان يعني قبل العدوان من كمال عدوان لمستشفى الشفاء كان يأخذ معنا وقت لا تزيد عن 7 ل 10 دقائق. اليوم بمركبة الإسعاف يستغرق معنا الوقت أكثر من نصف ساعة حتى نستطيع الوصول إلى مجمع الشفاء الطبي وهو الأقرب لنا في شمال قطاع غزة. فهذا المصاب لو كان هناك تدخل سريع وغرفة عمليات سريعة كان بالإمكان إنقاذ حياته وأن يعود إلى أهله وأبنائه وأولاده الصغار.
So Abu Hamza is sharing that we all know the lie of the ceasefire. There is no true ceasefire. Israel continues to bomb and kill civilians, maybe not as a mass scale as they did before, because they are busy mass slaughtering people in other regions now in Lebanon and Iran, but they continue to target people. Actually, I'm watching a video of a paramedic who was just murdered by Israel. I don't know if you know him, Abu Hamza, but we just heard the news that Abdurrahman Husni Hamdouna, 31 years old, a paramedic, he was targeted and killed in a civilian car at Al-Katiba Square, west of Gaza. So there continues to be attacks on people, on doctors, on nurses, and paramedics. The problem now, people who went back to the north, they have no access to care. The closest hospital for them is Al Shifa Hospital. And in the normal days, in normal times before this attack, it used to take about 10 minutes for the ambulance to get an injured person from the north of Gaza, from let's say Beit Lahia to Al Shifa Hospital. Now, with the situation of the complete destruction of healthcare, no roads, the minimum it takes is about 30 minutes. That's the only hospital they can go to, Al Shifa Hospital, but it takes the ambulance about 30 minutes. And unfortunately, the ambulances that they have, they're already in bad conditions. Many times they even break on the way, they cannot make it. So we are losing lives now just because they don't have access to care. So this is also emphasizes the importance that they need a functioning hospital in the north that people can access within minutes rather than more than half an hour. تفضل.
فلذلك دكتور نحن من خلال يعني ترميم كمال عدوان وإعادة تشغيل كمال عدوان يعيد الأمل، يعيد الحياة لأهلنا في شمال قطاع غزة وينقذ حياة الكثير من هؤلاء المصابين الذين يعني بشكل يومي يتم نقلهم إلى مستشفيات مدينة غزة.
Yes, thank you. So this is a project of hope for the communities that are there in the north. Any support you can help, you can give, will give people more hope, will give children and women and elderly and men and anyone impacted in the north to get access to care. We have the link in the chat. Please donate. Please share the link. Please spread the word. We need your help. The victims or the communities, the victims of genocide in the north need your help. They need your support. And honoring Dr. Hussam and his colleagues, more than 100 healthcare workers continue to be tortured in the Israeli torture camps, and the more than 10,000 Palestinian hostages who continue to be held illegally by the savages and the barbarians, a nation and state called Israel, still need your help and your support. So please, the link is in the chat. Please donate. The project is still going on. We are just changing some logistics. We're dividing the work, which is fine. We need more organizations to come and help. None of us alone can do the whole work. So we are really grateful for Helping Hand to expand their project that they're going to cover the whole emergency room now, which give us the opportunity to rebuild Dr. Hussam department itself, the pediatric ward and the NICU. Please donate. Please share the word. If you know anyone who can donate, if you know anyone who wants to pay their zakat or pay anything, or take the tax money instead of giving it to the government to buy more bombs to slaughter children in Iran and Lebanon and Gaza, I think you owe it to yourself and to your children to use your tax money, the hard-earned money that you worked for a good cause, to save children, not to kill children of others. So please, everyone, we need all your help. We need to help everyone, the help of everyone, to help the communities in Gaza, in Palestine, in Lebanon, in Iran, in Sudan, in Congo. This project is particularly important because there is literally no access to care in that area, and any help you can give will save lives and will have an impact. تفضل أبو حمزة.
يعني أنا دكتور نضال، معرفتي بأطباء ضد الإبادة يعني منذ وقت قصير وليس طويل، ولكن عملكم عمل عظيم. لذلك يعني أنتم بإذن الله عز وجل على قدر من هذه المسؤولية، إعادة ترميم كمال عدوان ومجمع كمال عدوان الطبي، وإعادة الحياة لشمال قطاع غزة. وكما تحدثت بإذن الله بجهودكم الكبيرة وأعضائكم المنتشرين حول العالم، بإذن الله سننجح معكم بإعادة الحياة لمجمع كمال عدوان الطبي.
Yeah, شكرا أبو حمزة. So Abu Hamza saying that knowing Doctors Against Genocide, knowing the good work that they're doing on the ground and their track record of not just talking the talk, but also walking the walk. Because as you all know, Doctors Against Genocide was established mainly as an advocacy group. We were not focusing more on aid and relief efforts. But because of the need, because we were forced to, now Doctors Against Genocide as they call it, is a one-stop shop. We do everything. We do advocacy, we do education, we do support, we stand with the community, we expose the criminals, and we do it all from A to Z, whatever it takes to hold the perpetrators accountable, whatever it takes to help and support the communities impacted by their crimes is something that comes under our jurisdiction, and we're proud and we're happy to do. And Dr. Abu Faris, Abu Hamza, sorry,
أبو حمزة.
Abu Hamzi is saying that he does trust DAG and DAG supporters, that they will be there for them and they will help them rebuild their hospital, because their track record has always been that they meant what they said and they helped when they were asked to. And we don't want Abu Hamza and his colleagues to change their mind about us. We want them to continue to trust us. Please do everything to help support rebuilding hospitals. This is an act of morality. This is an act of medicine. This is an act of resistance. This is an act of saying no to the empire. This is an act of saying no to the Epstein file. This is an act of saying no to all those who are exploiting and destroying our world and our humanity. It is an act of doing what is right with your hard-earned money, with your taxes. Use them in the right for the right causes, rather than give them to those in D.C. that, despite being Democrats are so angry with Trump with war, they could not manage to pass a resolution to hold him accountable. They are all bought, unfortunately, by the lobbyists. They're all bought by the ruling class. And we, the people, are the one who need to make the change. We cannot trust the politicians from either, side to do the right thing. I think by now Gaza has exposed all of them and liberated and freed all of us. And we owe it to Gaza, all of us, to be there for them and to pay them back. The least we can do is to help them survive this brutality that the whole unjust world have visited on them in the last 2+ years. And thank you, Abu Hamzi. شرفنا. And we promise
حياك
you
الله.
not to let you down, never to let you down.
حياكم
شكرا
الله
Dr.
حياكم
Sakhir.
الله
Inshallah, we will keep going, and we will keep working
إن شاء
together.
الله
And inshallah, you will be working in the hospital soon. And inshallah, we'll see Dr. Hussam and his colleagues
إن
coming
شاء الله
back,
يا رب إن شاء
joining
الله
you, and inshallah, all of us here we go and be part of that celebration.
حياكم الله دكتورنا شكرا كثير الله يحفظكم بارك الله
Allah
فيك
يعطيك
شكرا
ألف عافية.
شكرا.
الله يعطيك
سلام لك
العافية.
دكتور ولكرامة ولجميع
كرامة
الزملاء.
بتخبي، كرامة بتخبي اليوم، ما بعرف شو مالها خجلانة ولا صايرة شيخ، صايرة شيخة شكل اليوم، ما بعرف شو.
سلامات سلامات يا دكتور سلامات.
مع السلامة. هاي دانيا هون
سلام.
Dr. Swiyang. There's a panelist here that I don't recognize. I don't know who's this guy. How did he come? I mean, who are you? I mean, are you DAG? Are you part of DAG? Have you ever been here? Did we meet before?
Who are you talking to?
I'm talking to you. Who are you?
السلام عليكم رمضان
Oh,
كريم
it's been a long
رمضان
time.
كريم
Welcome. It's
عليكم
always good
السلام.
to
It's a
see
long
you.
time no see والله دكتور نضال
Guys,
دكتورة إيمان دكتورة كرامة والله I miss you guys so much
he called me
all
yesterday.
of you والله
لاقيين لك
He,
أكثر.
الله
Karama,
يبارك
Karama
فيك يا
Dania,
رب
he called me yesterday. He sent me a message. Guys, do you still have a spot for me at DAG, or you already forget about me? I told him, where have you been? Where have you been disappearing all this long? So,
والله I was like oh my god it's just the
ما
endless
أرجع حكيت
suffering you
لك،
know
أنت إلك الباص كله مش بس سيت، إلك الباص
والله
كله. أهلا وسهلا.
والله والله الله يجزيك الخير الله يجبر خاطرك
أهلين.
يا رب
It's good to see you. أهلين. Where's your dad? Guys, this is
he's
Dr.
next to me right
This is
now
Dr. Ahmed. This is
Oh,
Dr. Ahmed Son. أهلا
السلام
وسهلا.
عليكم
نورت.
السلام عليكم ورحمة الله
We
خلي
always say DAG is a family. It's a family business. So that's why you and your family, Karama and her family, and Rihna, we're just supporters. أهلا وسهلا.
I'll give the opportunity for my son Muhammad to start and I'll continue after him. Okay, go ahead.
يا أهلا وسهلا.
والله I don't know where to start, but it's been a while. That's first of all. I see that the DAG figures are just going so high, mashallah, tabarakallah. We have around 120,000 followers on Instagram. So I see the success that we have achieved in the past few weeks or months. So alhamdulillah. Thank you guys so much for what you're doing. I can see that we are making good progress, I would say. And just keep going. You are on the right side of history. So speaking about what we can speak about. Okay. So I can hear that a lot of people are saying that we are in a ceasefire agreement between us and Israel, and that's unfortunate when some people believe these things, you know. For example, today they have killed 4 people in the middle of the Gaza Strip, Gaza City. So 4 people were killed, you know, from the policemen. 4 of the policemen were killed today, and it has never been a ceasefire. It has never been a peace between us and Israel. It's either us or us. There's no ceasefire. There's no peace. That's it. So after we have lost many people after the ceasefire, after they announced about the ceasefire, we are still in suffering. It's not just, you know, the like it's not just they are killing people and so on. No, there's so many types of suffering. Like you can see what's happening in the world right now. Like for example, they are closing the borders every time. We have, like for example, I own United for Gaza. I work for Palestine Aid. I work with Chit Chat Network in UK. We have raised more than £50,000, and we can't get this money here because we are not just being we're not just being fighted by Israel. No, all the European countries and the West countries are fighting with Israel because one of my friends, she's Alexandra, and she lives in the UK. She has a company bank account, and we used to use her bank account to receive our funds, our donations, to make, you know, projects in Gaza Strip, to build tents for people, maybe to distribute food or iftar meals. Unfortunately, when they knew that she's sending money to Gaza Strip for these purposes, they closed her bank account. So we are still suffering. We're still suffering. Me as a volunteer in my charity, I can get the money to do projects. So now we have stopped doing the projects for the people in Gaza. You know what I mean? So it's bigger than a fight or a war or a genocide between us and Israel. This is the first thing. Well, when you ask me about what's happening in the world right now, I would say that we are so close to the end. Not the end of the war, it's the end of the world, I would say, because we can see the circumstances of the day of judgment. Wallahi, I can see it. Really, like we can see Iran is threatening Israel that they will bomb or target the nuclear bombs in Israel, Diomona or whatever it is. So we can see that maybe it is coming to an end, but it is not the war that is coming to an end. Maybe us, maybe the world is coming to an end. So wallahi, I'm so happy. I'm so happy. We had our turn. We have watched everything. We have lost our loved ones. We have watched, like we've seen many bad things. We have lived the worst days of our lives. We have seen many things. We've lost many things. So now when we see the world is suffering just like we used to suffer, I mean, like I can laugh right now. It's so funny, you know? Like wallahi, Allah is fair. You can see that the when you have been punished for 2 years and you were suffering for the past 2 years, and the world is saying that it is not our case, it's Palestine, it's not ours, it's yours, so you can just go and fight your own against Israel and against the world. Why the hell would I need to fight the world? Well, it's fine. It's fine. I'm happy right now because when Saudi Arabian people says, "Okay, why you're not talking about Saudi Arabia?" I would say it's not my case, you know? So now we were seeing that all the people they said, I mean, they were standing against us, or they were standing at the wrong side of history. We're seeing now.
Muhammad, just for the record, we don't necessarily agree with your sentiment, but since you are the victim, we're not going to censor you. Say it all. Say all what you feel, even when we don't agree with it. We did
No,
not go
I'm
through
gonna
the
make things
genocide.
clear.
We
I'm
did
gonna
not
make
go
things
through your
clear.
pain. So say it all.
No. I'm gonna be clear here because there is a important thing here that I need to mention it, which is I really wish the Arabian governments will just be destroyed because they deserve it. But I really pray for the people, you know, the people of, like I would say, some good people, the poor people, the Muslim people of Saudi Arabia, of the United Arab Emirates, maybe some other world. I wish they will be safe all the time, you know, because in like every house
But the
has its
government, yes.
bathroom. You know, every house has its bathroom. So every country has the bad people, you know, and the good people. So that's what I'm saying here. That's what I'm saying, Dr. Nadal. That's what I'm saying. Allah yarda
But
alayk.
again, silence qualifies them as bad people. So I don't excuse the people, honestly, to be fair with this too.
That's it.
I don't
Not all of
excuse the
them.
people, whether
Not,
they are
of course.
Arabs, whether they are Muslims, whether they are Americans, whether they are Europeans.
I
The
agree.
people,
I
their
agree with that.
silence and the fact that they allowed the genocide to happen live streamed on their iPhones for 2 years, they have no excuse.
That's
go
right.
ahead.
When you're silent and you're watching the genocide in front of your eyes, you can see it with your naked eyes, and you're silent, then your turn will, wallahi, it will come to you. And now we're seeing this. Alhamdulillah. So I ask Allah, everyone will take what he deserves. That's it. The good people will take good things, and inshallah Allah will save them, and the bad people Allah will punish them. That's it. So
But
what's
did
happening
Allah,
in Iran?
was Allah silent too or no?
What?
Did Allah help the people of Gaza or no? Was Allah
Of
silent
course.
too or no?
Of course.
Okay.
Of course.
No one has an excuse. Sorry.
No. No one. Wallahi, no one. This is what I'm saying. So, alhamdulillah, now we had the tea with ginger with Dr. Ashraf Abu Al-Aziz, and we had iftar together just before 2 hours ago. And alhamdulillah, we ate mandi, so we are fine now. We're just watching the crimes that's happening in the world. Our turn is done right now. We're not fighting anyone. We're just sitting in peace here, even though we're being bombed again, but it's fine. We used to be bombed, but alhamdulillah, we're good. You know, when they started to like the war between Israel and USA and Israel and whatever, when they started it, like the borders here were closed. Why the hell would you close the borders? We have nothing to do with this war. But alhamdulillah, everyone was real scared. The people were in a rush. Everybody went to buy food, food things for his family and food and goods and so on. Everyone was trying to make big storage of food, and we have an Arabic saying here, which is اللي اتلسع من الشوربة ينفخ في اللبن, which is if you have tried to live the bad circumstances and you have seen some of these circumstances again, then you will take whatever it is to avoid being in the same situation again. So that's what we have seen. The border was closed, the prices were getting so high, but alhamdulillah, now I think the food will go in the next few days. So that's it. Wallahi, alhamdulillah, we are fine, guys. Thank you so much for your messages. Wallahi, I have received many messages from Dr. Nidal, and he's sending salams and many things. So thank you guys so much. Wallahi, I respect it. And alhamdulillah, we're just watching. We're not fighting right now. Our turn is done. It's over. And maybe, who knows?
You just got all of us in trouble now, yeah. It's good to see you. Always
No,
good to
it's
see
not
you.
me. It's not me, wallahi.
We're all
It's not me.
fighting behind the scenes because of your comments now, and we have a storm and we need to Iman,
Wait,
thank
no.
you. Thank you, Iman. Sorry, I apologize, Iman. You know what I meant, but it's okay. Thank you. Muhammad,
Wallahi, I have
tell us
nothing to
about
do
your
with
project.
this.
What are you doing? What are you doing now? You said you were trying to do some philanthropy in Gaza and open small projects to help the people. So are you
Wallahi,
doing this? Tell us more. How's that going?
I have started my pledge, which is for keepfoodgoing.com. It was kind of successful at the first of the pledge started. Like, we have raised more than 10% or 15% of the money that we needed. But unfortunately, as I told you before, my friend's bank account unfortunately was closed by her bank. So we couldn't receive the rest of the money. And I unfortunately, I had to close the domain. Temporary, I would say, inshallah, hopefully temporary. Now we have no way to receive the funds. We have a lot of money in the UK, and we can't receive our money. You know, this is a big problem for us right now, because when you have a charity, you need to just keep going with the projects and to feed more families every day. But now we have a partnership with Palestine Aid, and even Palestine Aid can't get the money through Gaza Strip. So we're trying to solve this problem right now.
That's what happens when you start making projects with other organizations and not with DAG. If you were with us,
Wallahi, I told you,
we
Dr.
will still
Nidal,
get
it's
you the
your
money.
fault.
It's
not my
on the
fault.
wood, guys. Knock on the wood. We are still able to get the
guys
money.
all need to hear this. You guys all need to hear this. Wallahi, it's not my fault. I told Dr. Nidal, we can do projects. You can just work with us. And I don't know why he was busy. Maybe I'm not gonna blame him. But Dr. Nidal, I told you before. Wallahi, I told you.
It's okay. Never too late. It's never too late.
Never too late. That's it.
Yeah, let's go. You tried
That's what
grown
I'm
up, you
talking
come
about.
back to us. أهلا وسهلا.
أنا جاهز والله. I was born
خلاص.
ready والله. فالحمد لله المشروع اللي كنا بنعمله, the project that we decided to make, which is to, you know, hire more people in Gaza Strip, and they will, inshallah, over the time they will spend on their families and so on. It was successful, but unfortunately, as I told you, I couldn't get the rest of the money. So, and I'm just waiting for the conditions and for the situation to come down a little bit, because it's I would say it's still hard, and we can still hear some bumpings and some, you know, people are killed every day. So inshallah, maybe one day they will go to stage 2 of the ceasefire agreement, and then inshallah we can have the relaxation and we can do these things. But I have it, and I promise I will make this true one day. I believe in this project. I believe that there is no one inside of the Gaza need to ask for money. We don't need to ask for money. We can make the money get money. You know what I mean? We can hire the people here and we can make money. That's it. We don't need to ask for money for ourselves. Then we spend the money and then we ask the money again for the money again. No, this is not who we are. And the people of dignity, they can make ways and they can think about other methods that they can get money from. And it's more dignity things, I would say, not just asking for money. And this is all what they care about. So inshallah, one day, and you
Muhammad, you
know,
are a proof. You are a proof that Gaza always educates all of us. So we are ready. We are ready to be educated by you, and we are ready to help. So let's talk more about it. We're happy to work. And now I'm confused now. Who should I ask to talk next? Your dad or Dr. Ashraf Abul
Yes.
Aziz? Are they next to each other or what?
He is here. No, he's not. Dr. Ashraf is, you know, he went to sleep, I think.
No,
Dr.
he's here.
Ahmed.
He's here on the panel.
Oh.
So you and Dr. Ashraf
Oh.
Ahmed, Dr. Ashraf and Dr. Ahmed can talk with each other.
والله دكتور أشرف.
دكتور أشرف وينك؟ أهلا وسهلا نورك.
أهلا وسهلا دكتور نضال.
أهلين كيف حالك؟
والله بخير الحمد لله.
How come you're not together? What happened?
No, I had to excuse myself. I mean, Dr. Ahmed has overfed me during my trip over here. I mean, you can't imagine how much food he offers me every time. And he insists on me to eat and eat and eat. And I'm going to... Can you imagine someone coming to Gaza and coming back gaining weight? I mean, this is unheard of. But just believe it or not, this is the most peaceful place on earth right now. With all what is going on, the craziness that's going on in the world, Gaza is the most peaceful place. The people are so peaceful. You see their smiles, you see their optimism. They are starting businesses, they are doing charities, and mashallah, they are so resilient and so great. It is great to be among them, wallah. Wallah, this is a wonderful experience.
Dr. Ashraf, you know, the best news that we heard today, that they postpone your traveling
I know.
is for 1 week later. This is the good news for us. Uqsim billah, I swear to God that I felt happy. I know that your family is waiting for you, and your colleagues and your friends are waiting for you. But also we are in need for you, because you give us all the positive energy that we want. Every time.
I think both you two are the most positive and the most inspiring people. I mean, we have met. I mean, we always once you are here, we feel relaxed.
I mean, when you talk to Muhammad, you talk to Rayyan, you talk to Dr. Shaza, everybody is so optimistic, and they talk about what happened with a big smile, and it's like things happen, and they tell you like horrible stories, but it's just like it's history now. And they are going on with their life, they are rebuilding, they are doing surgeries. I have been in surgery today, doing kids 1 week old and women 72 years old, and the surgeons are there, and everybody's working, and everybody's is so growing, and it's amazing. I mean, I can't describe it enough to everybody, but everybody has to come and see it for themselves.
So
when you get the chance to do that.
It's a big honor, and we are proud of you, Dr. Ashraf. And really, when we are talking with you and sitting with you, we are feeling that we are sitting with Nidal, with Dania, with Dr. Iman, with Maribeth, with Dr. Aswi, and everyone, and Karama, and everyone. So we are feeling that everyone in DAG is inside Dr. Ashraf Abul Aziz now in Gaza. So even he told us a lot of secrets that we really proud of it. He told me that Dr. Swi was in Lebanon and she was a witness on Sabra and Shatilla, and she managed the Palestinian injured patient there and the Lebanese patient there, or targeted there. He told us about the effort of Dania and Iman while they are preparing for the Zoom, and they are the cornerstone of that. He told us about the effort of Karama and Maribeth and Dr. Nidal and everyone. So Dr. Ashraf create for us a channel, a private channel with Doctors Against Genocide. My friends and my colleagues, I will start on the 8th of March. Today is the Palestinian Woman Day. We salute the Palestinian woman, which is a symbol of strength and patience and generosity. So we have a holiday today because of that day. We extend a special tribute to the Palestinian women police officers who have proven their presence in the field despite the difficult situation and circumstances, and they were in the ongoing siege of and aggression. They have also offered martyrs. I mean, the Palestinian women who fell while performing their duty, and especially the police woman, and they continue their mission of serving their community and protecting the homeland with courage and dedication. Every year, the Palestinian woman remains a symbol of steadfastness and endless giving. This is for the Palestinian woman. I want to talk about the situation in Gaza. My colleagues, my friends, we have to remember that the genocide is going on. Yesterday in the West Bank, 3 Palestinian unarmed Palestinian citizens were killed by the settlement who were gunned, who were armed by M16. They killed just, they tried to defend about their land and their people and their trees and their what they belongs and what they have possessed. They try to defend against that, and unfortunately, they were executed by in front of all the cameras and the media, and no one mentioned about that, no one condemned about that, no one talk about that. I also want to talk about the crime that happened 3 hours ago in El Katiba in Gaza. They attacked a car with 3 or 4 martyrs. They passed away in that attack. So I think the Israeli occupation forces are not forgetting Gaza or West Bank. They are put that in their mind, and I think they will not forget Gaza or the West Bank until they are beaten. I want also to talk about the suffering that we are having nowadays in Gaza. Really, we have a break of respiratory problems, especially bronchoconstriction and bronchospasm due to the weather, due to the rubble, due to the odor, due to the sewage system, which is destroyed. We really nowadays in the emergency room, we have every day 90% of cases are coming with wheezy. Even without positive family history of bronchial asthma, without positive family history of eczema, without positive family history of atopic dermatitis, without positive family history of hyper IgA or allergic rhinitis. I mean that they have no history of bronchial asthma, but they are coming wheezer. All that child or babies are wheezing due to bronchospasm, due to the bad weather that Gaza is suffering from it. And this is one of the example that it is spacer. Spacer we are using with Bicotide or Ventolin or Salbutamol, and use it for the babies to put the nebulizer and to deliver the inhaled corticosteroid for the babies. This spacer is the only one that we have in Nasser Medical Complex. We explain the mothers that they have to use by this spacer, but we are, instead of it, we give them that bottle of water, and we ask them to cut it from here and put some plastic for here, not harm the baby, and then try to put the MDI or meter dose inhaler from this side and put it like that on the mouth and the nose of the baby to deliver the inhaled corticosteroid and salbutamol. And this is really one of the ways or alternative ways that we are trying to manage that problem. This is one of the examples about the shortage of equipments and medical supplies in Gaza. This spacer is not expensive, and it is not harmful for the for Israel and for safety of Israel. It is not alarming for Israel. It is not harmful for Israel. Just plastic. What we can do with it? Just saving the babies from bronchoconstriction. This is one of the examples. We also still suffering from the instability of formulas. Up till now, we have babies who are coming with crying, and they are screaming at night because of a change formula every 2 to 3 weeks. They are coming by distended abdomen, by floating, by vomiting, by diarrhea, by allergy, by skin manifestation, by not gaining weight, sometimes by blood stool due to instability of formula. We still suffering. Dr. Ashraf is the best he can describe about the lack of a lot of instrument for anesthesia and ICUs. I want to talk about the situation which is going in general in the area, that there is a Turkish proverb: when a clown moves into a palace, he doesn't become a king, rather the palace turns to a circus. عندما ينتقل المهرج إلى القصر فإن القصر يتحول إلى سيرك واللبيب بالإشارة يفهم. I want to thank everyone in this webinar and this Zoom. Really, inshallah, next month we see Dr. Nidal and Dr. Dania and Dr. Iman and Dr. Aswi and Dr. Maryam and Maribeth and everyone. We will see you inshallah in Gaza, وإنشاء بصحبة الدكتور أشرف أبو العز. Thank you. Thank you for everyone. It is a good honor for us to talk about that. I want to mention also that Dr. Ashraf, inshallah, will give us a lecture in the next days about sedation for intubation and sedation for some procedures. What is the time of sedation and anesthesia that we have to use, and what is the advantage and disadvantage for everyone. Thank you again. Thank you for this webinar. Inshallah, see you next week.
So, Dr. Ahmed, before you go, since Dr. Ashraf is here, how's the situation? And we know at one point there was shortage of anesthesia and medications, but since you're doing some surgeries, Dr. Ashraf and Dr. Ahmed, how's the situation now? Do you have all what you need available, or only limited amounts or limited options? I know at one point they were only using maybe one anesthetic versus the others. Can you tell us more about the availability there?
Yeah, the problem with medications is severe. So what happens is that sometimes UNICEF or the WHO, they get some of the medications in limited amount and they keep it. So if there is like a dire need for a certain medication, use it. But if there is not, you have to use the alternative. And the alternatives are not the best drugs that are being used. So, for example, propofol, they have very limited amount of propofol. So we either use thiopental, which I haven't used for more than 10, 15 years now. It had been obsolete, but now they are using it again. We use ketamine. It is available, but again, in limited quantities. Even blood pressure cuffs, they don't have enough blood pressure cuffs. They don't have all the sizes. They have, when they have a deficiency in an ECG cable, in an EKG cable in the OR, they cannot repair it, and they don't have replacement for those cables. Very simple stuff. They don't have thermometers in the OR. They can't measure the patient's temperature. The suction, it had been the suction canisters had been used for hundreds of patients. I mean, you can see that the suction canister is so dirty, like what they are using. But they are managing and they are doing major procedures. They have been doing cervical fusion. They have been doing multiple level laminectomies. Today we did perforated gastric ulcer. We did the Hirschsprung disease on a 1 week old baby. So they are doing procedures, major procedures, but there are very, very critical limitation of things. And they managed to, like what Dr. Ahmed was describing, like the spacer, for example, they can't have a spacer, so they managed to get something to replace it and to go with it. They don't even have tape, the regular tape, something as simple as tape. They don't have like good tape. They have like the very old tape that's very hard to cut and very hard to stick. And so these are the kind of problems they have. What we use in the US, and we take it for granted every day in the operating room or in our practice in general in medicine, it is a luxury over there. And they don't complain about it. They just go on with that. They said we have been through worse periods of time. They said we had mass casualties with 200, 300 patients being intubated on the floor and in the beds and ICU. So for them, this kind of minor things are nothing. It's just like, for me, I mean, I look at that and say, I mean, this is unheard of in the US. But for them, they go on with anything, and they accomplish a lot. And I'm very impressed with the healthcare personnel over here. All of them, they are really impressive. With the limited supplies and the limited capabilities, they are doing like wonderful work. And again, you can't appreciate that until you see it with your own eyes. I mean, again, I'm encouraging everybody, if you do have the chance to come over here, just do it. You will never regret it. I mean, this is going to stick with me for the rest of my life.
Yeah, thank you, Dr. Ashraf. This is a huge testimony. Yes, we are very, inspired by our doctors in Gaza. We want to use this opportunity, the testimony that you just gave, for all our colleagues to advocate that Gaza is still under siege. Medical supplies, medications, equipment are still not allowed in. They are managing with the basic minimum, if at all. So we need to provide for our doctors. They did not choose to work under these circumstances. This is all imposed on them. And we are actually taking this a step further based on some suggestions and the call we received from our call in Gaza. We want what you just mentioned, what they practice, to be taught in medical schools. We want to document this. We are in the process of starting a book called Gaza Medicine Under Siege. And we are inviting you, Dr. Ashraf and Dr. Ahmed. Dr. Ashraf, you will be, along with your colleagues in Gaza, writing the chapter on anesthesia, how you can manage to anesthetize, to do major operations, major surgeries with the huge limitations that you just mentioned. And Dr. Ahmed will be writing about the pediatrics, how you can manage a baby in the ICU without surfactant, without baby formula, without this and that. So this, I mean, this experience, we know it's regretful that anyone in the world has to go through this, but it's also a teaching moment, and it is something that needs to be documented and honored. And I think we in the West, as you said, we have the luxury of everything. We throw equipment and medication left and right, and the CT scan that's 2 years old, we throw it away and we get a new one, and the MRI and all these things. And every patient who just says hello to the emergency room doctor gets 3 CT scans and 4 MRIs and $10,000 of labs and medications. They don't have this. So honestly, there's a lot for us here who practice in the West to learn from this. Just doing 2 MRIs and 10 CT scans and having all the luxury and having all the subspecialists around you. I mean, it's good. It's okay if you have it, but that's not true medicine. That's not what makes the doctor ready to practice under other circumstances. And unfortunately, since this world is going on fire, we expect that what happened to Gaza is happening now in Iran or Lebanon and Sudan and Congo. So whatever they learned, whatever improvisations they have to come up with to manage, it's something that other doctors we can learn from. I need to learn from them here because just in case, God forbid, if there's a natural disaster, if anything happens and we don't have all these tools, how we can manage. So I think medicine now can learn a lot from Gaza. And we want this to be not an advocacy book, not a PR book. We want this to be a medical, scientific book that when you don't have all these things that you learned in Western textbook, how you can manage. This is important. And we don't want the sacrifice of our people in Gaza to go in vain. So everything they learned from going through this experience is something that the whole world, the global medical community can learn from. So thank you, Dr. Ashraf, for being there. Are you there? I need you one more minute, Dr. Ashraf, if you're still there. Dr. Ashraf, okay. Dr. Ahmad.
Very good. Yes, Dr. Nidal. You
Yeah,
know,
so
Dr. Nidal, today Dr. Ashraf was saving life for a woman who has perforated gut, and she was shocked and hypotensive. Her blood pressure was 60/40, and he gave her norepinephrine. And unfortunately, while shifting her from section to the theater, the pump was depending on just electricity, and there is no battery in the pump. So she was more hypotensive, and the blood pressure was near zero. And when she is on the theater, they again give her the norepinephrine, and she's, alhamdulillah, she's in good general condition, and they did the operation. Dr. Ashraf told me that this is not happening in any place in the world, just in Gaza. Just in Gaza. If we want to talk about what happened in Gaza, about shortage of medication and the drugs and medical supplies and the crimes of the Israeli against Palestinian, we need a near 10 edition of Nelson textbook in its volume to talk about that crimes.
this is exactly what we want to do. This is exactly what we want to do. We want to write all this up and make it 10 editions of real medicine that Gaza can learn and can teach, that Gaza can teach the world. Please, yeah.
Yes, I want to talk about what I have here on the updating of the Senator Bernie Sanders from the United States. He's his comment on the American-Israeli war on Iran. He talked that Netanyahu is a right-wing extremist who has committed horrific crimes, which I consider to be acts of genocide against the people of Gaza. Sanders added that Donald Trump is now effectively serving Netanyahu agenda in Iran. Also, we have to remember that the occupational forces or Israel are using the Epstein files to continue the war against Iran. New documents have been released accusing Trump of sexual crimes. To understand the timing of the release of the Epstein files and the scandals, that who is primary responsible for them. We have to mention and we have to remember that. Thank you again.
Thank you. Before you go, Dr. Ahmed, Dr. Ashraf, do you consider yourselves to be my friends or la?
Of
I
course,
need your
brother,
help,
friends
Dr.
and the
Ashraf. I need a
brothers.
personal favor from you, from Dr. Ashraf. Are you my friends?
Friends and the
Of course, we
brothers.
were
I make
talking
a
about
mistake.
this.
Every
Not
webinar,
only,
I
not only a friend.
yes. Every as usual, every webinar
Dr.
I make a
Ahmed and
mistake.
myself,
Yeah, every webinar I make a
we
mistake.
had a
And
high.
this mistake I need your help with Dr. Ashraf, Dr. Ahmed. Do you know عطوي شو معنى عطوي دكتور أحمد ولا لا؟
شو معنى شو؟
عطوي لما واحد يزعل واحد بياخذ ناس بوديه عشان غراضوه. عطوي I don't know. What do you call it, Dr. Ashraf, in Egypt? شو بسموها؟
I don't know what you mean. What's that?
Yeah.
It's
Like
you mean
if I
ransom?
did someone
Like
mad,
taking
if I
somebody
did
for
something wrong,
ransom?
if I did something wrong to someone, I need a few friends to come and go to that person and ask for forgiveness and please امسحها وشي زي هيك. What do you call it in Egypt?
Oh,
It's like ransom.
What?
Ransom.
مثل الجاهة.
جاهة انه
جاهة
جاهة. I want Dr. Ashraf, Dr.
يعني
Ahmed جاهة.
واسطة
مش واسطة يعني.
we call it واسطة.
طب anyway, I need your واسطة. I need your واسطة and your جاهة. أنت دكتور أحمد with Dr. إيمان. أنا زعلتها. I did something wrong and asked for their forgiveness because I cannot make Iman upset or زعلها لأنه إيمان is everything.
Nobody should do that, Dr.
I did it. It's my
Iman
mistake.
is the
Your
sweetest
job now, if you
person.
consider yourself my friend, you and Dr. Ahmed to fix it. يلا please.
خلاص المسامح كريم، احنا في رمضان الحمد لله. خلاص دكتور ايمان معلش المسامح كريم.
مسامح كريم يلا سامحينا
يلا.
مش زعلانة يعني خلاص احنا زي أشرف قال احنا في رمضان and I already told you don't have to ask me for you don't have to say sorry to me. You have somebody else you need to say sorry to.
Okay,
So don't worry about me. Okay.
I did. I take care of that private business, but with you, I want it to be public. I want them to know it. The private business, I take care of it. Don't worry.
All right, we're good alhamdulillah.
Thank you. شكرا إيمان. شكرا دكتور أشرف ودكتور أحمد. هاي احنا شو بسموها الجاه؟ بتاخذوا كنافي فيها ولا تذبيحة ولا منسف ولا شو؟
والله
رمضان بتدوها منسف افتر رمضان.
حسب
الوضع، حسب قديش الجريمة.
حسب الوضع. بس احنا في حالة in case of دكتور إيمان بصراحة we need كنافة and shawarma and everything.
Is Muhammad still there, by the way? Is Muhammad still there?
Yes.
Did you eat
I can't go. I can't go
you...
away without hearing the food. As soon as I hear the food things, I just come quickly.
So, by the way, did you get a chance?
Dr. Nidal.
Mandi. جاد.
Did you hear?
Dr. Nidal.
Did you get a chance to eat shawarma or not yet? Because
yes, of
2
course.
years ago you were dreaming of it.
Wallahi, I was dreaming of it. That's right. Wallahi, that's 100% right. Alhamdulillah, we ate shawarma, we ate mandi with Dr. Ashraf. Wallahi, it was so delicious.
ممتاز. Alhamdulillah.
Alhamdulillah. I'm good. I can stay in Gaza for more than 10 years right now.
Nidal, the best way to make it up to Dr. Iman is to send her كحك مصري وغريبة. Yeah,
I'm gonna buy it today and take it to me with me to DC next week. شو what's the name? كعك وإيش؟
خلاص.
But it has to be Egyptian. I'm sorry, but it has to be Egyptian kahk, okay?
I'll ask for Egyptian
Rose
kahk.
water and any of that other stuff. It has to be Egyptian.
Egyptian kahk. What else? Give me the list عشان I have 2 days to prepare.
From the Lebanese, dear ward.
Thank you, Iman. Yeah, I'll ask the Lebanese people to make Egyptian kahk. Yeah, it's gonna be maybe a tough ask, but we'll see.
لبن العصفور هذا.
Okay, guys. Let's go a round of reflections, everyone. Let's start with Dr. Swiyang, because as Dr. Ahmed said, she has more experience in this. She's been to this fight more than any one of us, starting at the Sapra Shatela massacre in 1982 or 83?
82.
82. Yeah, تفضل Dr. Swiyang.
Well, I'm, with all this going on now, Iran, okay? And I think although life is very, very difficult for so many people, you talk about resistance against genocide, resistance against occupation. To live is to resist, right? And to survive is to resist. And when people want to take away your dignity and give you a choice of either death or dignity, and you choose dignity and freedom, that is the most steadfast resistance. And I'm seeing it before my own eyes. Every time when starting in 1982, after the massacre, when I think everything is over, I see Palestinian children growing up, not afraid, to live and to resist and to struggle and against all odds. Then we went to Gaza. I worked in the first Intifada, and I see the girls growing up, beautiful girls, sometimes killed, but yet they're there. And because I'm a foreigner, every time I got to leave the Palestinians and I come back, and they're still there. That is the mood, okay? So, and now I come to the stage that it might be a tough struggle, but when you think about God, why does it make it so difficult for the Palestinians? Because as human beings, we can't see from God's perspective. I think God can see that this is a people I love, and this is a people whom I'm going to give the gift of being able to bear all this hardship. That's my reflection for today.
Wow, very powerful. Thank you for this. This is really powerful. And you got Iman on board, so you said the right message. Thank you. You made up for my mistakes.
Okay.
And thank you. Now we have actually Mr. Zarni. We don't hear a lot from him, but he's here on call, and he has a lot to say about imperialism, about genocide, about the empire. I don't know if he's available or not. Mr. Zarni, are you there? Mr. Zarni? Okay. If not, when he's available, we'll go to Dr. Shitab. Mariam, any reflection, please?
I mean, I think I already shared what's been going through my head earlier.
Dania.
I, I actually really don't know what to say. That was beautiful, Dr. Sui. It's just been, it's been very difficult, just these last few days. And as everybody said, just when you think it doesn't get worse, it just somehow, the evil empire regime shows us that it can. But yeah, I think what's also very this space that we share together, we're able to hear the most horrific things and share a laugh with people that are there, undergoing like the worst circumstances. So I don't ever take that for granted. And I'm, thank you to everybody in this space. And I also encourage everybody, which I did for the first time today, as we were hearing about the Kamal Adwan project, is just imagining Dr. Hussam walking into his unit.
Thank you, Iman. That's the least we can do. The least we can do. It's a promise from us that, inshallah, by the time he is freed, that he will go back to his unit to take care of the children and the patients that he sacrificed for them. Thank you, Dania. And I know it's heavy on all of us. It's heavy on all of us. Mr. Zarni, thank you for joining us. And actually, I really want to hear your reflection because you are deep, you're powerful, you have been in this fight for a long time. But with one promise, don't get all of us in trouble, please. We want to be educated. And we are brave, but there are limits. Don't get all of us in trouble. But I do want to hear from you, please.
Yeah, thank you, brother. I have been listening. I wanted to come every week, but I could not make my schedule work. That's why I apologize. But
Can you introduce yourself? Sorry, I did not introduce you. Introduce yourself because maybe some members here did not see you when you
yes.
came on our webinar a few weeks back or a few months back.
Um, I'm I'm Johnny. I've been in exile for 37 years. The first in the U.S. and U.K. I was a professor of education in the U.S. and I was working in Brunei as a professor, developing a research program on South China Sea. Then my own country of Myanmar was committing genocide, and I started writing. My university tried to censor my public engagement, so I resigned. But that was about 13 years ago. I focus on genocides and imperialism, and I heard Dr. Swan Yi earlier reflected on her, Christian perspective. But I'm an atheist. But it doesn't matter. What matters is that I find Palestinian, Burmese, and other liberation movements to be connected through um, their powers to trigger a very deep human empathy, and also I would say rage or anger. And so I oscillate between, in terms of my reflection on why I come to the seminar or I follow the Palestine or Sudan or other, dire the struggles. Uh, I oscillate between this empathy for the oppressed that struggle to live a dignified and free life, and the anger against essentially Western capitalist imperialists. And so these two things that keep me going. I'm 62, going into 63. Dr. Nada, I wish to contribute more to the Doctors Against Genocide's work. You mentioned about recording the experience of Gaza people into some kind of professional lessons for doctors and others.
Yes.
And that's because I'm a useless doctor. My doctorate is
No, you're
PhD.
not useless. I read what you write. It's very informative. And we
Yeah.
would love to have you join with us and help in that work. Yes.
Yeah, and then so what I can do is I can write, I can organize, I can advocate, and I do want to, uh, enter Gaza if there are possibilities of like bringing medical supplies and anything. If there are the opportunities where a non medical doctor can accompany a delegation, so I can record and interview people the film the hospitals there, come out and you know to do something that can be valuable to other struggles out of the Palestinian struggle.
Yep. Thank you. Thank you. We appreciate you, appreciate all your work, all your advocacy, and we're happy and always open to learn more from you. And I'm sure you will be very helpful for this kind of work. And we want this work to be on a textbook level of professionalism and medicine and science that our colleagues in Gaza were first to do, and also their steadfastness, their resilience, their true medical ethics that they proved when they refused to abandon, when they refused to betray, when they insisted on life, when they insisted on medicine despite the high prices, despite many of them losing their lives or their freedom or their families. We cannot forget Dr. Al-Najjar, who lost 9 or 10 of her children while she was working, and her husband too, who is also a doctor. And just this is just one example of many. And we can never give our people in Gaza, and especially our colleagues, what they really deserve. And I think they have a lot that they can also teach us about. And we want this, we want to be part of it. We want to be just the platform for them. We want them to speak. We want them to be the educators. We want them to be the leading this. We are just offering the platform and the institution that they can, provide this work. So inshallah, we'll keep you in the loop, Dr. Zarni. Thank you for being with us. Iman, Dr. Iman Husni.
Assalamu alaikum, everybody. I think it's interesting just listening to everybody. These last few days have been very difficult, and I think there's just a lot of different emotions, right? So there's sadness, there's anger, there's overwhelm. I think some of the stuff that Muhammad was saying was lost in translation, but yet, like with everything that they've gone through, like what do you expect, right? And so I think there's room for all of those feelings, but the other thing just being on the call today is, I just realize that like as horrible and as evil as everything is going on, we are witnessing some of the most compassionate, amazing things about people, like the capacity of the human being. So it's not all bad. I know that it's so easy to focus on, and I get in this kind of rut too, where I'm like, I hate everybody, like there's no good people, and then I'm back with my tribe and I'm like, oh my God, there's so many good people. They're doing so many good things. And look at the people in Gaza and Sudan and Congo and the Rohingya, they've been going, I mean, this is not just, it's been a very long time, many years of hardship. And yet, they're hosting Ashraf, like he's like a guest visiting,
Don't gain too much weight, Ashraf. Don't gain too much weight. I mean, we will put you on the scale on the day you
Yeah.
leave Gaza.
I think he's put on weight. Yeah.
So I think sometimes we have to try to focus on there is good. There is a lot of good. And inshallah, good will win. And I know that Yiping has said, love wins, and I think we really have to kind of keep reminding ourselves that amidst all of the terrible things that are coming out. I just read something today about something that came out of an Israeli paper about like this rape and abuse of their own children. I mean, this is what's happening in their society. It's gang raping, and it's part of these religious uh I don't know what, I can't think of the word right now. I'm losing my words, but like, and so, things are crumbling, in a society and stuff, but I think we need to remember that there are good people, and inshallah good will win. So kind of went off on a
Thank you,
tangent.
Iman. Not all of us have a strong faith and deep conviction like you and Dr. Yiping. That's what's beautiful about DAG. When some of us doubt themselves or feel desperate or lose some faith, the others will remind us. So thank you for insisting on faith, on love, on humanity, and that goodness will eventually win. Thank you. Maribeth. Before I go to Maribeth, Iman and Dania, you are guilty now. Okay, I found a mistake on you. So I'm not the only one who makes mistake. What do we have coming next week? March 11th. You forgot to mention that. Yeah.
Oh, we have our day on the hill.
Yeah.
So
Yeah.
if you're
We need to talk about
available,
that, please. Both
we're
you
going
and
to be
Dania.
at the hill. We're really excited that Dr. Muhammad and Yiping are going to be with us. I think Tony is going to be with us. So if you can make it, there's still time to join us. We're going to be focusing on the Senate side because I think the House is on recess, but you know, the more the better. We're struggling a little bit with getting appointments, I think, because of what's going on in Iran, but we're gonna still show up, like we're gonna show up at their offices. We're going to keep pushing them and reminding them not to forget about Gaza, not to forget about Gaza. We'll also mention Iran and Sudan and Congo and because we know it's all interconnected, but yeah, if you can make it, please join us. I don't know, Daniel, if there's anything else that you.
Yeah, we want to insist on ending this war on Iran and on Lebanon, along with also refocusing on Gaza. So please, it's this week. The day on the Hill is going to be on Wednesday, March 11th. We would love to have as many of you, doctors, healthcare workers, locally and nationwide, to join us. You can still make it. We still have a few days to plan, so please come. I think it does make a difference. We need to keep reminding them. We have to keep showing in their faces and holding them accountable. Stop this illegal crime and catastrophe they are visiting on the people of Iran and the people of Lebanon. Stop the genocide. Lift the blockade. This fake ceasefire, where no one is buying it. We are seeing our colleagues are still suffering. We're still seeing people being killed, children, women, healthcare workers. So please join us this coming Wednesday. You can still make it. You can come for a whole day, for half a day. You can come for 2 days. The night before, we have an event in DC. For those in DC, please, we have an event the night before. It's going to be March 10th at the Bawadi Hospital, which is owned by a Gazan, and it has the best food. They have a free Ramadan buffet. You can have the best food in the world because it is the food of Gaza. Please join us. We will have Dr. Yiping and Dr. Muhammad Mustafa will be speaking, and we will be fundraising for rebuilding Kamal Udwan and for all the good work that DAG is doing. And a reminder for those who cannot make it this week, you can call your representative, you can send letters, you can send emails. Please, there is always something we can do to stop this disaster before it escalates into a World War III or a nuclear war. Our politicians are irrational, they are psychopaths, they are messianic. We cannot leave our world at their mercy. We need to speak up, please, please. I mean, it was limited in Gaza, and they all claim that Gaza at least is a small territory and there is no danger from wider escalation. But now, because we let them do this in Gaza, they are using Gaza as a platform that they can spread it out where, spread it more. And we're talking about Iran, a country that has 90 million people. It's a huge country. You're talking about Lebanon. You're talking about if they are allowed to do or to get their way in Iran and Lebanon, they will expand in Syria. They will expand in the Gulf countries, everywhere. I mean, honestly, I mean, these are psychopaths. They have to be stopped. No genocide in history ever stopped on their own. No genocide in history ever stopped because the perpetrators just had a moral awakening and they discovered, oh, sorry, we were doing wrong and we apologize. Every genocider, every perpetrator, whether it's a leader, whether it's an army, whether it's a gang, whether it's a militia, whether it's a nation, they had to be stopped by force, by sanctions, by boycott. They had to pay a price. They will not, they have no ethics, they have no morals, they have no integrity. We cannot wait for them to do the right thing on their own. We need to hold them accountable. The medical community do have a voice, they do have a leverage, they do have a status. People here in the West, even here in the West, they lost their faith in the politicians. They know that the politicians are doing what their handler at APAC or the Mossad or the Epstein ranks are doing or forcing them or demanding them to do. And that's why we need to save ourselves. We need to stand up for ourselves, for our humanity, for our people here at home, and for the people all over the world. And for those who cannot make it this Wednesday, remember, April 15th, we are having a major event. April 15th, 1,000 white coats to DC going to the Capitol. We need 1,000 doctors, nurses, healthcare workers, paramedics, and their supporters, activists, whoever you are, please join us. I think it does have a very serious impact, and it has a lot of weight, a lot of significance when we can have, as Iman mentioned, every office in Capitol Hill being visited by 1,000 doctors. We need to storm that place. We need to show them that we, the people, especially the healthcare people who care about life, who go to school to defend life, do not agree with this. And we are forcing them to stop these expansions, these wars, these crimes once and for good. Thank you. Maribeth, sorry, we took your turn, but I needed to remind Iman and Dania of the DC visits. Thank you.
Yes, DC visits, fundraiser dinner Tuesday, Hill Day Wednesday, Iftar Thursday in Brooklyn. Busy week for DAG. We've a lot going on.
So New York on March 12th. New York also, there's another event for DAG in New York. Please, everyone from New York, pass the word to your colleagues, to your friends, to your circles. We have an important event. Dr. Yiping, Dr. Mustafa are joining us for an iftar dinner fundraiser in New York, Brooklyn, March 12th. So March 10 is iftar dinner in DC. March 11 is the DC Hell Visit Day. March 12th in New York. So we are busy, but we need to.
Alhamdulillah. It
Alhamdulillah.
is blessed, beautiful work to do.
Did you convert to Islam or what's happening?
No, that's just Arabic. Yeah.
No, actually a friend of mine when I was in Istanbul in 2024 to try and get to Gaza. A friend of mine, she's an Egyptian journalist living in exile there in Istanbul. And once she got to know me better, she did tell me, she's like, I really feel like your heart is Muslim. In time. Okay. But
No, Maribeth. Islam means submission to God. Okay.
Right.
People who are obedient to God. That's exactly what Islam means, you see.
Yeah. And you know what though? I'm really bad at following the rules of anything. If I was good at following the rules, I probably wouldn't even be here.
What?
Right?
Where would you be?
Because I would just stay following the rules of white society, militaristic society, or whatever. So,
No, you follow God's rule, not that kind of rule.
Okay. I'll work on it. Like my mother would say, I'll pray about it.
Yeah.
Humanity.
I'm sorry.
Humanity.
I have to go soon, but can I ask you a favor?
Sure.
Okay, right. I've just texted the CEO of Medical Aid for Palestinians and asked them to support this rebuilding the pediatric ward and the ICU. Okay. And he said he's very
Which CEO? Which CEO you said?
Of Medical Aid for Palestinians.
Her
Oh,
org,
okay.
the one she founded back in the day.
So I said that, look, it's a lot of money. So he said, can you just write him a very short kind of description and a proposal, and he will consider it urgently.
Yeah, absolutely. We'll work on it. We'll share it with you later today, inshallah.
Yeah.
You can
Okay.
type
I'm
it in.
sorry I have to go because there is this BMA British Medical Association. Oh yeah, I forgot to tell you, we managed to pass a motion against the IHRA definition, okay?
Oh, wow.
Which is going to be carried out on the
Thank
general.
you.
We have 170,000 members, so it's going to be a big fight, but we will do that. And the other thing is we have 3 motions against the GMC, all passed. Number 1, that GMC should not allow itself to entertain vexatious complaints against medical doctors. And number 2, if it persists in doing so, it bear all the costs if the doctor is exonerated. So that will make them think twice before they do that. So I'm sorry I've got to go now. So we have to tidy up that bit. And I'll see you next week. Thank you for letting me be part of this. Okay, thank you so much.
Bye, Dr. Sui. We love you.
Yeah, we love you. I love you, all of you too, because you're family, It is like coming into the communion of the saints,
Well, and really, like, you have the idea that you might have visited for White Coat Day and stayed with me has been my only real driving force in cleaning my own home. And now that maybe you can't come for White Coat Day, I'm like, how much do I really want to keep things spick and span around here? If
I mustn't tell you whether I'm coming or not, so they can keep it
right,
clean. Okay?
right. I need the external motivation.
Yeah. Thank you so much. Okay.
Yes.
Okay. Bye. Bye.
Bye.
Thank you, Dr. Sui. Thank you. Good luck. Thank you for everything.
Remember the short write-up, okay? Maybe 300, 500 words or something like that. Longer if you like, okay?
This means you're asking Karama to write it, because I know I'm going to write a few pages.
I have it written down as a task in my notebook. Due out.
Mary Beth, all right. Okay.
Yeah, but then Karama needs to assign someone to co-write with me because I sound a little bossy and mouthy.
That's
when
fine.
I write.
You are just fine. You are just fine.
I think the main thing is to really put it into that it's the only hospital in northern Gaza. It's outside the yellow zone, so the Palestinians can take possession of it. And then the important thing about who is Dr. Abu Safia. I think that will sell. Okay. Okay. Goodbye, folks.
Goodbye.
Yeah. Goodbye.
Okay. Also, while we still have Dr. Ashraf Abu Alez, I wanted to see, I don't know if people can see what I have. It won't show you. But this, wait, someone stop. No, don't call me right now. No, terrible timing. Anyway, you see? Can you see what it says?
Palestine Day. DAG is free.
DAG in a free Palestine Day. Because Dr. Ashraf Abu Alez had said apparently on August 10th, 2025, in 2 years, DAG will be in a free Palestine. And so I still have it programmed in my phone. 2027, we will all be DAG visiting a free Palestine.
Ashraf is already ahead of schedule. He's already
Yeah,
there.
he is.
And
He's a
making
go-getter.
the preparations for all of us.
Right? The advance party.
Yeah.
Yeah. So, thinking a lot about Western feminism and the preoccupation with dehumanizing predominantly Muslim societies and this sort of sadistic obsession around like unveiling women. Right? And it doesn't come down to actually respecting women. It's still using and exploiting women to dehumanize the entire society. Like, come on, United States. Like,
No, I think what they mean is they want them to be without veils. They want their hair to be available before they bomb them, because it's better when they kill the women without veils somehow.
right?
If they really care about women, about their freedom, at least they can stop bombing them and their families and their children.
Yep.
Yeah.
And like International Women's Day, how much I appreciate the women of DAG. I am looking forward to our upcoming togetherness week, Dagapalooza coming up for the week. I'm looking forward to Hill Day. I am looking forward to maybe when Dr. Husney goes to pray, I will go with her, because I do love to be with women in community like that. I just don't want a man telling me what to do.
I mean, you can take me. It's okay. I'm okay with a woman telling me what to do. If you and Dr.
I know
Husney
you
take
are.
me, I'll come and pray with you.
A smart man knows that he sometimes needs to be told what to
Okay,
do.
yeah.
No?
You tell me. Just tell me, take me, and let's make friends again with Dr. Iman.
Yes. Okay. Just us gals. You, me, Nadal, Iman, all of us. So thank you to everybody in the group. Thank you to life for what grace exists to have brought me to this point to do this work. And also, if any of our listeners knows anybody who has been in the military less than a year, you can get out on conscientious objector status. Easy. I have like the DoD directive for it, a phone number you can call. So if you have been in the military less than a year, you don't have to stay. You just sign up for conscientious objector status.
And you should not agree to participate in an illegal war to kill other people's children. Yeah, thank you.
Right?
That's important. Very, very important call. Please, thank you.
And doesn't it also make you think about how much can a parent love their own child if they will accept killing any child? So all of the political class here, the ruling class here in the United States, all of these lawmakers, these warmongers, how much do they actually really love their own children if they will kill any mother or father's child? Like, if you see children as an expendable resource, then what about your own kids, right? So again,
yeah, thank
we
you,
don't
Maribeth.
have to do it. We don't have to.
Yeah, thank you,
That's
Maribeth.
it.
Actually,
Thank you.
yeah. Last night, actually, I went home late, about maybe 11 p.m. or something, and I found my daughter crying in tears, literally like crying like I've never seen her before. And when I told her, I thought, well, what happened? Something bad happened? She said, no, I just was watching on her phone and she saw this young Lebanese girl fleeing the war. And the only thing that this girl could take with her is her cat. So I could not imagine, like myself, because we do have a cat that she loves. Of course, we care about the human beings and stuff like that, but it's just those psychopaths, as you said, they don't care about life, they don't care about humanity. I mean, just this little girl leaving everything behind her, their house, running bare feet, and the only thing she could, wanted to help or to protect is her cat, and she's holding her, and they're running in the streets, and that's broke my daughter's, heart, and should break every one of us heart. We all have children, we all have mothers, we all have wives, sisters. I mean, these people are being killed with our bombs, with our silence. They are the people like us. They love life, they love their family, they love their pets, they love their homes. I mean, imagine yourself, just someone just bombs your house or tells you, I mean, this even agreeing to this term evacuation. What do you mean evacuation? You don't have the right to evacuate me from my house, from my land. Who are you? Who are you to tell me evacuation? Or you think this gives you a check mark on the international law that because you warn people, because you ask them to leave, then it's okay, it's kosher. No, it's not kosher. You are a psychopath, you're a criminal, you're a war criminal. No one has the right to evacuate people. This is called forced expulsion. This is called a war crime, crimes against humanity, genocide. It's not evacuation. And imagine just yourself. I mean, she's just crying. I mean, would this happen to us? I mean, would I ever have to make the choice that I have to run and take Fiji, her cat, with her, where we're gonna go? I mean, we just don't feel safe in the world. And honestly, I know many stupid people think that we are safe here or safe there. I mean, no place is safe with such leaders, with such psychopaths, with such savages. No one is safe. I mean, we see ICE now coming to the hospital, coming to homes and separating families and arresting kids, elementary school kids. So it's just a matter of just timing. We need to stop it before it becomes the standard, before it becomes the fate of all of us, our children, our cats, our dogs, our homes, our jobs, our cars. You see the whole neighborhoods in Lebanon flattened. Why? Why? I mean, imagine your neighborhood being flattened too. I mean, are you saying that if, let's say, there is a strong leader somewhere else in the world and who doesn't like America just because they don't like Trump, they have the right to come and destroy all of us? I mean, does this make sense? I mean, what kind of hypocrisy is this? If you don't like Trump, that does not give you the right to come and destroy all America. There are human beings. These are people. There are ways to solve political conflicts. There are negotiations. You were negotiating. The people were, agreeable. The things were advancing. Everyone said we were, the last step before reaching an agreement. Then you start a whole unnecessary illegal war, slaughter people. I mean, this is crazy, guys. This is crazy. We have to speak up more. We have to talk to more people. Martha, are you with us, Martha? I know you were busy, Martha, all day. I hope you can join us for the end if you don't mind. Martha, are you there? Martha Miller? Maybe she's listening. She's still in the event. Karama.
Yeah. Thank you, everybody. It's always heartwarming, and this is a love place. It's a place where we can support each other and support the people that we care about, the people who are under bombardment and under siege. So thank you. Thank you for being with us. Thank you, Nidal, for always leading this with such big heart, and you're amazing.
Okay. I want to thank you too on the International Women's Day.
But
Okay, no, I want to thank you before you finish.
I don't want you to thank me, please. I don't like that.
Okay.
And then I just wanted to say that, one thing that is being normalized is the prisoners. Like Dr. Abu Safiya has been incarcerated for over a year. What right do they have to incarcerate somebody, a doctor who was taking care of his patients? There are 10,000 Palestinian prisoners held by Israel. They committed no crime. They were all in self-defense. Not a single Palestinian has committed a crime. We know that we are on our land. They came to us. They uproot our olive trees, and they take our freedom. They take our land. They take our homes. None of us is a terrorist. None of us wanted this. Not a single Palestinian deserves to be in prison. So, and not a single Palestinian deserves to be for their property to be removed or their freedom to be taken away from them. And the same goes for the Lebanese people who are now experiencing the same displacement. The same goes for the Iranian people who are experiencing the brutality of the Israelis. So no one deserves this, and we should stand up together against this till the last breath.
Yeah.
One question that came up is how do we support Gaza when there is a siege? We support Gaza when there is a siege by giving the resources, the financial resources, to be able to procure whatever they need to rebuild their hospitals, to rebuild their clinics. It is a miracle that we have been successful because we have medical points running, we have ambulances running, we are able to be supportive of colleagues who are doing surgeries, who are seeing patients. Over 20,000 visits have been provided in the medical clinic in north of Gaza where there is nothing. And that is by the support of everyone here and the people who are listening to us. So one thing that I'm really, really asking people to do is to follow us on social media. We need to expand. We need more members. We need more people to join Doctors Against Genocide. We need more donors. And we need to get bigger and stronger because unfortunately the fight ahead of us keeps getting bigger. So thank you.
And YouTube.
YouTube.
Yeah. And as a proof of concept, I know Dag promised everyone that we will build a field hospital at Al Shifa Hospital, and this project has been delayed for multiple logistical reasons since then. I think we start thinking about it, or we took that project August last year. Then unfortunately we did phase one, which is remove the damaged building, and we were ready to start phase two. Then Gaza came under bombardment in September and October. So that project got pushed back. We could not do it. Then we had so many logistical reasons after that. Then the winter came, and the plan of the field hospital was to build it with tents. But when we saw what happened to the tents, we thought, oh my God, no, we're not building a field hospital that's gonna have the same, deficiencies of the tents. So the engineers there, and again, the people of Gaza are the smartest people in the world. They know their territory. They know how to do it. They re-engineered the whole project, and they are, they said, no, we're not building with tents. We're going to build it with more durable material that we can build in Gaza. So the project was delayed, but as a proof concept, as an answer to the question that came to Karama, how you help our people of Gaza, we just got an update that the field hospital is back on track. The work there is speeding, and by next week, we will show you almost stage two is almost completed, and everything is back in business, all because of the um, ingenuity and because of the genius of the people of Gaza. They will always find a way. All they want from us is support them financially, but as always, we at DAG, we give them the agency, we let them plan, we let them choose what project they want. Like this with Kamal Udwan, we agreed with them last week about something, they changed their mind because they had a different, that's fine. Whatever you think, you lead us. We are here to support you. You lead, you decide, you tell me what you need most, how you want to do it, and we are here to support you. And we, inshallah, we will live this, we will live up to this model and continue to support them. So Dr. Kamal, sorry, Al Shifa Hospital, Field Hospital is back on track, and they're doing great job. In a week or two, we will show you the updated things, and inshallah, it will be completed in less than a month or two. While we're also building or rebuilding Dr. Hussam Absafiya pediatric department at his hospital. Our supporters, those who are donating to us, you have been amazing. We cannot thank you enough. The people of Gaza, the people of Palestine cannot thank you enough. None of this work would happen without you. We really appreciate you. We are really grateful. And please spread the word. We need more people to join. This is not just about Gaza. The situation in Gaza and Palestine is not a question of the Palestinian people. This is a humanitarian issue, a humanitarian question for all humanity, because if we fix it there, I really think that we can fix all the problems in the rest of the world. And as Karama mentioned, there is no Palestinian who is a terrorist. There is nothing called terrorist. We are all normal human beings. We were born into this. It was imposed on us by the West and by the anti Semites of the West who wanted to solve the Jewish question at our expense. None of us is a terrorist. Zero. Zero. No, there is not, and have never been a single Palestinian who is a terrorist. These are people who only want to live like anyone else on their land, in their homes, with their children, with their families, with dignity, freedom, like anyone else. We are not better than anyone else, but we are not less. We refuse to be less than anyone else, and we will fight by any means necessary anyone who wants to deprive or take away our humanity and our full rights like anyone else in the world. And we give this right to every human being in the world. If anyone here wants to attack America, American people, take their freedom, take their houses, demolish their cities, we will fight them. We will stand with them too. Every human being has the right, the full right to do whatever they want in their home, in their land, and no one else has the right to take that away from them. And finally, is this the International Day of Women? I want to thank all the leaders in DAG, the women. We really appreciate the women. The women have been the most amazing contributors to all this pro justice, pro Palestine, pro movement, pro freedom movement in the whole world, whether here in the US and everywhere. And the biggest example of it is here at DAG. We are majority women and female doctors, healthcare workers who are leading this work. I really thank every one of them. I especially thank Karama, the woman leader and co-founder of DAG. Thank you.
Thank me.
Thank you, Diana and Maribeth and Iman and Martha, if you're still there. And Iman, thank you one more time. I know you're praying. Thank you. Next time I'm going to pray with you. You will be the leader. Maybe we can have a first woman Imam in Islam, and I'll be happy to pray behind you. Actually, no, there are women Imams, but we want Iman since she's in DAG.
Dag Imam.
She can be our DAG women Imam. So that will be cool, actually. Martha, are you still there? We're about to close. Do you want to speak anything, Martha? Martha Miller from Boston.
You know, thank you to Mesa. Mesa is our
Where is Mesa? Yeah, I know. We miss
power
Mesa.
behind DAG.
Yes, Mesa is the women engine behind everything in DAG. All these things, the actions, the campaigns, the work that you see is only happening because of Mesa. I mean, everyone, honestly, we're really grateful for you guys. Martha has been amazing. Chris Fitzstevens have been amazing. There are so many people that have did so much to Gaza, so much to DAG, that maybe we cannot say publicly now without their permission, but they have been amazing, and we cannot be thankful and grateful enough for them. So, Dr. Ahmad, I think we can close. We can close at this. Please keep up the good work. Keep up the good work, and we are going to win. شاء من شاء وأبى من أبى. يلا دكتور أحمد, close us out.
Dr. Nidal, please, my last talk, please. I want to deliver this message for our colleagues, Roxana and I think Tom Pedroni.
نعم.
We appreciate their presence in that meeting and in that Zoom. This is a message from Dr. Ahmed Al-Farra and from the people of Gaza. Please, we want you to share with us and to be with us in next webinar and next Zoom. Because when I saw the video that took about 1 year of DAG, I saw a lot of activities that belongs to them, a lot of ceremony, a lot of testimony, a lot of festivals, a lot of activities that it was done by them. I really, really, really appreciate if they were again and joined us, because we are supported by them and we need them as they need to be in our webinar. Thank you.
Yeah, they are with us, and inshallah, I mean, last week Dr. Bedroni was with us, and inshallah next week all of them will be back. So, but
Thank
since
you.
we cannot say no to the people of Gaza, honestly, so far we never said no to Gaza. We will take this not as a request but as an order. So inshallah we will have them back soon.
Should
ولا
I
يهمك. بتمون يا زعيم، انت الزعيم، انت بس فصل واحنا بنلبس.
حبيب قلبي.
should I share the video?
ايه؟
Should I share the video?
يلا شير ذا فيديو، يلا سنس منشن ذا فيديو. هو بحب الموسيقى، ما هو بحب بده يروح يرقص في وين نوروي، وين الفيستيفال اللي بتقعد ترقص فيه تغني فيه؟ شو اسمه
فيش
الموسيقار
مكان
تاعك؟
في غزة، فيش مكان في غزة ترقص فيه.
لا شو اسمه هذا مرة حكى لنا عن مطرب ايش؟ We don't hear you كرامة. كرامة we not hear you. You are muted كرامة.
بحكي بده يروح على هولندا.
هولندا، شو اسمه المطرب بتاع هولندا؟ يلا ان شاء الله ان شاء الله.
ليش أمستردام؟ ما بعرف.
بدل ما تغلب حالك بتجيب لك
ريو
بتجيب هولندا عندك، ولا يهمك، بلاش نغلبك، اليوم مش بجيب لك هولندا عندك.
ان شاء الله.
يلا كرامة, share the video and we close. Thank you. Thank you everyone. We'll see you next week.
ضحكتنا يا
ريتها ما تبلع الضحكة.
واو.
طبعك دوم جبارة، شلون غزتنا كل الناس بعتنا يا غزة
تستهدف المدنيين. يعني أول شيء تم اجتياح شمال قطاع غزة وإطلاق الحصار عليه ومنع أبسط الأشياء التي تساعد الحياة من دخولها إلى شمال قطاع غزة من طعام وشراب وعلاج ودواء، بالإضافة إلى الاجتياح المباشر اللي تم إلى مستشفى كمال عدوان واعتقال كافة الكوادر التخصص.
Canada's complicity through arms deals, diplomatic cover, and the shameful promotion of weapons expos like CANSEC fuels the machinery of genocide.
I stand with Doctors Against Genocide because every doctor should in fact oppose genocide.
طبعك دوم جبارة، شلون غزتنا كل الناس باعتنا يا غزة. طبعك دوم جبارة، شلون غزتنا كل الناس باعتنا يا غزة نوارة. طبعك دوم جبارة.
Thank you. Let's also thank
جبارة، شلون غزتنا كل الناس باعتنا يا غزة نوارة. شلون غزتنا كل الناس باعتنا
يا غزة نوارة. طبعك دوم جبارة، شلون غزتنا كل الناس باعتنا يا غزة نوارة. طبعك دوم جبارة، شلون غزتنا كل الناس باعتنا يا غزة نوارة. طبعك دوم جبارة، شلون غزتنا كل الناس باعتنا.
Wow.
Always wow.
That's only because of all of you. Thank you, everyone who helped us, who was with us,
Truly grew
whether in the
weary of
streets, or in the halls of power, or the classrooms, or everywhere. Thank you.
All right. Yalla, goodbye on this note.
On this note, yalla, salam. Thank you. See you next week, guys. Thank you.